to the Tuesday morning meeting of the Board of County Commissioners for July 28th, 2020. We'll first start with item number 1, adjustments to the agenda. Are there any adjustments? I don't see or hear any. So we'll go on to item number 2, emergency business. And I need to clarify this particular item. We had 2 items last week that are duplicative here, and we had some technical difficulties on our platform at these times when each of these came up, and I apologize, but before I asked for the vote, we didn't get actual motions and seconds prior to our votes. I was concentrating a little bit more on trying to get the platform to work for everybody. So what we need to do here is make sure we get these on record with motions this time. So I'll start with item 2A, order 20-07-21-07 in the matter of approving a cost of living adjustment for non-representative classifications. Is there a motion to approve?
So moved.
Second.
Moved by Commissioner Bozovich, second by Commissioner Burney. Any discussion?
Chair Buck,
yes.
Chair Buck, I would like to declare a potential conflict of interest regarding this item. My son is a member of AFSCME, works for Lane County at Lane County Behavioral Health. In this issue, based on input that I've received from the Oregon Government Ethics Commission, I believe I do not have a statutory conflict at this point, so I will participate in the vote on this item.
Very good. Any other discussion?
Chair, I just wanted to clarify, this is the approval of the cost of living adjustment for non-represented employees. The AFSCME contract that you did approve last week had a motion to second. Again, this one, as you noted, is coming back because you took a vote but didn't have a motion in second. So it's just a cleanup for the non-rep item, not the AFSCME item.
Thank you for that clarification.
Okay. Well, now I'll call for the vote. All those in favor, please say aye.
Aye. Aye.
Aye.
Aye.
All those opposed, say nay. Motion passes unanimously. We'll move on to order item 2B, order 20-07-21-09 in the matter of approving a deposit of $10 million with the Public Employee Retirement System to establish a side account with an amortization term of 10 years, together with a $2.5 million employer incentive fund match from the state of Oregon in order to reduce the county's future PERS liability. Is there a motion to approve?
I move approval.
Second.
Commissioner Sorensen, second by Commissioner Burney. Any discussion?
Yes,
Commissioner Sorensen.
thank you so much. I just wanted to mention something that I wasn't able to mention last time on this item because my computer wasn't working, and that was that much of the savings that we are putting into the savings we obtained that's going into this is because of the work that we've done over the years to have a self-insured program for our employees' health, and that the estimates of the amount of money we need for that coverage has resulted in more money piling up in that account. And that's really a direct result of the focus that we put on employee health. And we'd never had that incentive under the old insurance system, and now we do under the self-insured system. And we're really saving the taxpayers a lot of money. And then what we're doing with that money is even more savings because we are buying down the retirement costs. So I think this is really a great thing. And I just want to thank not only Steve Mokrahysky on both the health side as well as the finance side, but also all the people involved in both the finance and the health side. So lots of people out there in the organization that deserve this credit. Thank you.
Thank you. I'm glad you were able to speak on that, because part of the issue on this item last week was I was trying to figure out how to get your audio working. Commissioner Farr.
Thank you, Chair Buck. Commissioner Sorensen points out some of the facts that, one to Mr. Mokrahysky, $10 million is a lot of money. Can you give us just a real quick brief on where the money comes from and exactly how much it will save, or not exactly, a ballpark of how much it will save?
Sure, and I believe Christine Moody is on the call, so she may be able to provide some additional information. But as Commissioner Sorensen noted, the investment from the county is coming largely from our health insurance reserve. And, you know, we have done a lot of analysis over several years. After we shift to do a self-funded plan, we want to make sure that we have a healthy reserve in that health insurance, employee health insurance account, because we are self-insured. So claims are our responsibility. So if we see a spike in claims or some really large claims, we want to have the ability to have a reserve to be able to pay for those. So we've built up a good reserve there for that purpose, and we've done a lot of evaluation and analysis and sought consultant feedback on what the appropriate reserve is for a health insurance fund for the type of claims that we have. And what we're proposing here in terms of this $10 million investment from the county is an excess reserve from our health insurance fund that was developed by that reserve was created by all 32 funds across the organization contributing to it. And so we really needed to identify an investment that was appropriate for all 32 of the funds to make. And of course, we feel like there is a really close nexus there with our PERS account, as we've done a great job of stabilizing and managing the growth in health insurance costs. PERS is an expense we don't have a lot of control over. We don't have the same kind of control that we do over health insurance with PERS, because it's a fixed benefit. The state determines that. The cost is the cost. And really the only thing we can do is do these types of investments. In a prior legislative session, the legislature approved this side account program that allowed for a 25% match. And so we really feel like this investment, the 25% state match, helps to buffer and mitigate the risk of an investment in the market. You know, because we are making investment in a mixed portfolio of investments, and there is an element of risk in that, but the 25% match from the state buffers that risk. So it's a long answer to your question, Commissioner, which is to say that the majority of this investment is being made from our health insurance reserve. Commissioner Sorensen is accurate in saying that we've built up that reserve there over many years through good management of those costs, and now we want to make an investment that really is going to aid over the next 10 years. So our plan is that this will reduce our expected PERS costs over the next 10 years. So it's a good thing, I think, for the public to understand and for our employees to understand that we're making an investment in the long term here, one-time funds that will help us over a 10-year period of time. And then I want to call on Christine, because I don't want to misquote the amount. We looked at a number of different years of investment, 10, 12, 15, 20 years. We felt like 10 years was a good period of time to capture that savings, in large part because over the next 10 years is when we see our PERS expenses spike. And then around 10 years from now, the expectation is they level off and start to drop. So let's really attack the growth in PERS costs during the period of time it's the greatest concern. So I think that was the only other piece of your question that I want to make sure we get an accurate answer. And is Christine, are you on the call?
I am. Thank you.
Yeah, thanks.
Chair Buck, Commissioner Farr. So yes, the amount, I think last week I gave it to you in terms of a percentage decrease. So our rate, PERS has projected for us that over 10 years, we'll have about 1.53% decrease in our rate because of the PERS side account. That equates to just over $1 million, or sorry, just under $1 million a year, likely. So if you put that over the 10 years, when I do the rough math calculation, just assuming the market stays the same, all of that kind of stuff that are metrics that could change, it could be as high as about 7 million additional savings. The only other thing I will mention too is that the 10 million that we are putting in also came from our workers' comp. So another area of concentrating on health in a different way than health insurance, but making sure that we avoid workers' comp claims by making sure that we have a safe work environment. And so we had seen those claims go down. And so we also had some excess reserves in that fund. And so the combination is where we've come up with that 10 million.
Thank you, Steve and Christine. That becomes very, very close to answering the question. And this is $10 million we're investing, and over the 10 years, we'll save about 7 million. So what happens to the 10 million after the 10 years?
Well, it is being spent down at the same time. So what PERS will do is they will open, they call it a side account because it's not in our main PERS account. So it will earn investments the same way. PERS will invest that money in the same way they invest the entire fund. And so what they will do is pull from that account every year of the 10 years in order to pay for about 1.5% of our PERS rate, if that makes sense. So they're pulling both accounts at the same time.
That is a perfect explanation. Thank you. And it allows us to fulfill our obligation to the promise that the state of Oregon has made to retirees, Tier 1 retirees principally, that the courts have upheld, something that we're all very interested in making certain we fulfill our promise. Thank you very much.
Any other discussion? Okay. Well, that was good to revisit there. It was very interesting to hear the dollar amount. So thank you for that, Christine. So at this point, I'll call for the vote. All those in favor, please say aye.
Aye.
Aye. Aye.
All those opposed, say nay. Okay, motion passes unanimously. We'll move on to public comments. Now, this is a reminder, we're still in our virtual format. So for those that want to do public comment, at this time is a good time to raise your virtual hand. And you only have to click that hand icon once. When you are called upon, you will have 3 minutes to speak. In the event that we have more people than we have enough time for, we may need to lower that amount or do a random pick of people. We haven't had to do that yet, but looks like we don't have that many people on this morning, and so we should be okay. And when you're done, you'll be muted again, and you can watch as long as you want. At this point, I'll toss it over to our moderator.
Thank you, Chair Buck. At this time, I will open up for public comments. If you wish to give public comment, please raise your virtual hand. I do see we have one attendee, but I do not see your hand raised. Mr. McFadden, would you like to give public comment? I will unmute you. Mr. McFadden, it looks like you are self-muted. Would you like to give public comment today?
Can you hear me?
Yes, we can now. Would you like to give public
Hello,
comment?
Good morning. I just wanted to give a short comment kind of related to the topic I was discussing last week. And I'll start by kind of describing something that I think you all are probably familiar with. I think anybody who's studied biology has probably heard of the Stanley Milgram experiments. And in short, what essentially those were about was a research experiment where subjects were induced to inflict pain and even up to like lethal doses of electricity to actors who are participating in the experiment. And to boil it all down, what it ultimately showed was that that people were willing to do really terrible things to other people if they were under the impression that an authority figure had given them permission to do that. And as that relates to police work, I really think that it's important in the conversation around police reform and, you know, handling and addressing police brutality so that that's not something that people have to suffer from, that we realize that political figures and political leaders have a role to play, and that when political figures and leaders message things in certain ways, it oftentimes broadcasts and signals an acceptance or a tolerance of unacceptable behaviors. There's a whole concept of normalization of deviance, which is a whole other topic I don't have time to go into, but really affects organizations, and in particular ones like Lane County and the city of Eugene. So I just really think it's important that you all as a group message your intentions really carefully, so that you're not unintentionally giving approval to things like police brutality or abusive behavior. I think that, you know, nationally, in state and region, here locally, there's a big problem with leaders kind of fanning the flames of extremism, and that puts the public at risk. And so I really just wanted to bring that up. I know that you all are probably familiar with who Stanley Milgram is, and just want you to kind of think about how those things affect the profession of policing and the roles that you all have. Thank you.
Thank you for your public comment. At this time, I show no one else signed up for public comment, so I will return to Chair Buck.
Okay, we'll move on to Commissioner comments and remonstrance. Commissioner Sorensen.
Thank you very much, Chair Buck, and to the commissioners and and staff and public on the virtual meeting. Thanks very much. I think this is a great opportunity that we have on our agenda for commissioners to give their perspectives on things. I spent some time over the weekend and Friday and Thursday, actually, looking for published plans by counties on how they were responding to the COVID-19 crisis. And I don't really see any plans. I think that was understandable, you know, in March and April when this thing was really hitting the United States, at least in a big way. We didn't really know what to do. We had some ideas of how this disease was transmitted and what we could do about it, but we really didn't know, and it really was a true emergency. I think now, from what we know, at least what I've learned, is that it's very transmissible, and it's transmissible mainly by you know, the respiratory system, your nose, to a limited extent your eyes, but mostly your mouth and nose. And if we can get people to separate from each other, if we can get people to put masks on, get people to stay home as much as they can, we can really beat this thing. So my point this morning is to talk about why we need a plan. And a plan in my mind is, you know, we've got a great plan. We've got one, it's called the strategic plan, but we've never incorporated, or we haven't incorporated the COVID-19 into the plan, where we get some measurables like how many people are we going to test? How many people will it take? How will we get the number of infectious cases down? The number of infectious cases has risen from March to the present. The number of deaths, pretty good, only 3. That's not really a big factor yet. Hopefully it won't be, but we need to get the infectious cases down. We need to get the testing up. and we need a plan. Now, we do have a plan. We just have not amended our plan. We've not put COVID-19 into our plan, and yet, you know, it'll be August in less than a week, maybe even later this week, and we still don't have a plan. So I think we need to direct staff to bring us back a plan, and the plan should, you know, cover the goals and then also the strategy of how we're going to get to those goals. And for example, if we have a goal of getting people to wear masks, how are we going to get them to get to that goal? So I think we're at a point where if we're involved with this for another year or two, this has risen to the level of something where the board has to amend the strategic plan, because this is obviously something very significant for our community. So I'm taking this time this morning to urge not only staff to recommend changes in our strategic plan, but the board to ask for a plan of how we're going to deal with this. I'm sure there's plenty of people in our public health program that are working their tails off, and we get reports on the valiant work that volunteers are doing, that professional staff is doing. What I would like to see is a plan, and I'd like to have a discussion of that plan rather than us treating this like this is a house fire and we turn it over to professionals who go put the fire out and then we're done. I want to, you know, this is not that kind of emergency. This is something that needs a plan. And I'll conclude with that, and thank you also for our public commenter.
Commissioner Farr.
Thank you, Chair Buck. I would expect we'll get a response regarding what the plan is that we have in place. I wanted to, as I gave you a heads up before the meeting, Chair Buck, I'm going to talk about an item that's on the consent calendar. Instead of pulling it from the consent calendar for separate discussion, very briefly, I wanted to mention, which is item 20-07-28-02 in the matter of appointing 3 members to the Poverty and Homelessness Board. Just wanted to ever so quickly point out the Poverty and Homelessness Board is adding 3 members who are replacing 3 older members. The board is 15 voting members and has a number of non-voting ex officio members that are on the board. Now, the members that are being appointed today are business representative, victim services for adult systems, and a housing co-applicant from the CFC, the Continuum of Care Grant. Those are 3 regular positions on the Poverty and Homelessness Board. Now, the Poverty and Homelessness Board has 15 described positions that need to be filled by somebody who fits that category. 5 of them are elected officials, 1 from Springfield, Eugene, and Lane County, 1 from at large, an at-large elected official, which is often filled by the sheriff, and the other is from an elected official from rural Lane County. The other 10 positions are broad-based and predominantly revolve around people who have either lived experience or provide direct services concerning poverty and homelessness, including shelter and including supportive housing. I've mentioned a number of times that the board has 7 different committees that meet and do the preponderance of the work of the Poverty and Homelessness Board is done at the committee level. I'll talk more about that at some point in the future, Chair Buck, but I wanted to acknowledge and make sure that everybody who may be listening understands that it is a 15-member board. Each position is specifically designated who will fill that position in terms of the category. Thank you, Chair Buck.
Any other discussion? Commissioner Bozievich.
Thank you. I want to spend my remonstrance talking a little bit about the events over the weekend. First, I want to take a minute to thank the members and organizers of the group Black Unity here locally, who has successfully carried out multiple peaceful assemblies and opportunities for people to exercise their free speech rights. They're doing it right, and I just want to acknowledge that. Unfortunately, there's people that are trying to co-opt and use their demonstrations to go on to spur violence and destruction in our community. And I'm particularly concerned about how this mob violence has chosen to actually target a certain local business because they exercised their free speech, you know, almost a year ago. You know, it seems like there's no reason other than they specifically targeted the Elkhorn Brewery because the owner spoke out about some local political issues. That to me is the definition of suppressing free speech and intimidation of speech. You know, and should not be tolerated by anybody and should be denounced publicly by all public officials. And it just incenses me to see that sort of thing happen. You know, that is just, you know, beyond the pale. It's like, you know, if people went around and found the organizers of Black Unity's homes and started terrorizing their homes to try and suppress them from having their protest. This is the equivalent of it. And the poor owner was trying to take a family vacation this weekend and had to rush home because he got a report that his business had been vandalized. So, you know, it just, I can't say enough how we need to consistently denounce the use of, you know, violence and property destruction and intimidation against people in any format. You know, it's unacceptable. Just as unacceptable as the idiot that pulled out a gun and shot off a blank during a demonstration. You know, all of that was meant to intimidate. And we just need to stop it. And we need, and particularly, who are you hurting? The workers of those businesses, many of them that are low income, many of them that are people of color also. You know, who are you hurting with that destruction? You know, on top of the COVID emergency that's already put a lot of businesses on the brink, which has caused them to cut hours and wages to employees, which puts them on the brink of evictions. You know, it just does not make sense. And we need to have it stop. And people have to speak out against it for what it is, which is just pure violence and destruction that should not happen. And we, you know, I fully support everybody's right to assemble and peacefully protest, and even to peacefully, you know, have civil disobedience. No different than those folks that walked across the bridge in Selma and allowed themselves to be arrested, even violently, at that time. Or, you know, the way Gandhi and his supporters allowed themselves to get arrested when they tried to make salt. Still, they did not have any violence and they didn't do any destruction. It was civil disobedience. There's a difference between the two. And we just need to not tolerate that in our community, and we need to speak out against it. And we need all of our leaders to speak out against that property destruction and violence in any way, and intimidation in any way. Thank you.
Commissioner Burney.
Mr. McFadden, since you provided public comment, I would like to say I agree with you. The roles that we play, the words that we say, the tone that we set does have implications and does ripple out into the world, and I agree. Not just elected officials, all of us have to be very careful that we're not sending the wrong messages and inciting things. It's obvious that this, I'm learning after a year and a half, this agenda item really means commissioner responses to public comments and anything else that's on your mind. So I would like to also suggest that it's taking greater vigilance in confusing times where emotions are high and everyone is scrambling to maintain a unity of focus. And remember, We are all sisters and brothers. We all love one another. And even the degree in which Commissioner Sorensen said we need a plan, obviously we have a plan. Obviously that's constantly under either attack, criticism, construction, redevelopment. But please, let's not point fingers at each other, is I guess my only comment here. We are living in a moment which I'm starting to call, it's not just an economic collapse. It's not just a global health pandemic. It also seems to be it's not just civil unrest. It seems to be a great reckoning for all of the ills and inequities that we have been living with and various people contending with at different levels of intensity throughout our country's history. And I think this is a moment where we practice patience and love and dedication of effort and intensity of service to everyone, and try our hardest not to point fingers and get upset with one another. That's all I have to say. Thank you so much.
Any other comments? I'll just add, in light of people doing it right, I have heard that one of our employees, supervisor and nurse practitioner Cindy Morgan, has done a phenomenal job and is receiving a leadership award this morning and is going to retire. So I just want to thank her for all her wonderful work. It sounds like everybody she's been supervising has been doing a wonderful job under her leadership, and here she is on the screen. Hi. Hello. I thank you so much for your work, and I know those that work with you are sad to see you leave. Do you want to say a few words?
Sure, I absolutely do. Thank you. Actually, they had sort of an impromptu event for me this morning, which I wasn't prepared for. So I am prepared a little bit this morning. And first of all, it has been wonderful in my career here at Lane County Public Health. I feel very privileged to have done so. But I really think that my greatest accomplishment here at Lane County was hiring great people. And I really strive to hire people who wanted to work together as a team and felt there was some real value in coming together and working as a team. And so what I would like to ask is that now I have everyone's attention that, you know, the communicable disease team has been in the ICS structure. So just the team started in January. We expanded that structure to all of public health. We expanded it to even larger, and then finally involved many other folks from across the county. And I would, this team, the communicable disease team, really deserves a robust thank you. And I think that often the leadership of public health hears about what a fabulous job they do, and they certainly do. Their leadership and their vision is so important. But I would ask that the staff of communicable disease also hear a robust thank you from the Board of Commissioners. And this team does this important work every day. And so often when we do our job well, everyone notices, because we are keeping our county and our communities safe. And this past 6 months, this team has sacrificed family meals, vacations, and dog walks just to be at work every day. We have changed our schedule to be here and cover our office 7 days a week. And it's really because of their work. I know I'm the one who's retiring and I'm the one who's being honored today, but it's really because of their work and their passion and their knowledge that is keeping Lane County safe. So I thank you for your, I thank you for this recognition today, and I want to use it as an opportunity to recognize my staff.
Oh, thank you. I didn't know you were going to be on the screen today, so that just happened to work out. So thank you, communicable disease team.
Sure, right, Chair. Just kidding.
Does anybody else, and then there's not a line item for recognition for an employee today. So this is kind of just spontaneous, but if anybody wants to say anything, this would be great.
Oh, was I not supposed to speak yet?
No, that's great. I mean, if you want to speak, that's okay. We'll make space for you.
Oh, I thought this is when I was supposed to be recognized. I heard you say something about my leadership, and I was like, oh, I was on the phone talking
That's
to.
just fine. Commissioner Burney.
So we have a completely spontaneous but prepared for statement. Hey, I just want to, Cindy, thank you so much, and forgive me, but your comments really allowed me to illustrate a point made earlier, which is we are working our hardest. Everyone is working their hardest. They've changed their lives. They're attempting to provide service. So again, I just think we should never dismiss the hard work and effort people needing services and people providing services are intensely doing, as we literally, if we took a few steps back, we are literally re-knitting a social service framework in our community without a lot of federal guidance or help as we move forward. Thank you so much, but congratulations to a life well lived.
Thank you, and thank you. And now I'm just totally embarrassed. It's probably, I think I spoke out of turn, so.
You're just fine. You're just fine. Anybody else want to say anything? Commissioner Bozovich.
So I just want to say thank you, Cindy, for your leadership. And, you know, typical of a good leader, she praised everybody under her in her team and held up her team as who we should be honoring. So it just shows what great leadership she has. And I've said, you know, during some of our conversations around our COVID response in the past, just what an incredible job our public health staff has done. And
Absolutely.
It shows consistently in the reports by county from OHA, in our percentage of contact within 24 hours, our lack of random cases in this county, where we've been able to trace almost all of our cases back. We're just, and, you know, our low actual case count and death rate in this county, you know, which is lower than the state average, which is one of the lowest in the country. And I attribute that purely to the work of the local health department here, and just that incredible amount of work you guys have done 7 days a week doing educational work, whether it's answering the hotlines or it's 7 days a week doing that contact tracing work. Between the educational work you guys do and the contact tracing and all that, that's really what's been helping us be successful here in Lane County. And the staff in public work and public health really has to get kudos for that. You know, you don't really need federal guidance to deal with communicable diseases. You guys have shown that, whether it was the meningitis outbreak at the University of Oregon, or some of the measles issues that we've had, or just dealing with the constant issues of some of the STDs and other communicable diseases in our community. You guys do a great job, and the way you guys have stepped up and worked 7 days a week to control this pandemic has been just incredible.
Thank you.
Commissioner Sorensen.
Well, I wanted to take a moment to not only thank Ms. Morgan for her many years of service, but also, as she mentioned, all the people that she's hired and she's brought into the organization and really mentored and turned our public health team into the success that it really has been. It's not only the current public health crisis, the global pandemic, but it's these many other epidemics that the team has really worked so well and has just almost made it seamless, so that prior to this global pandemic, the concept of public health wasn't something that people were discussing every day like they are now. And so to me, it really is a credit not only to you, Ms. Morgan, but also to the whole team of people. We could say we were lucky in the current COVID crisis, but I think that luck often happens when people prepare and really are able to solve problems. And I think that's what has been done. And I know in the case of my district in particular, we've had several of these threats and epidemics that are potential epidemics that really were solved by the hard work of all these people that we're honoring by what we're talking about today in your work. So I really appreciate all of the work you've done over the years, and I just wanted to really thank you. Thank you so much.
Thank you.
Commissioner Farr.
Thank you, Chair Buck. Cindy, I'd like to spend as much time as other commissioners have thanking you, but I'll just simply say thank you. Your work speaks for itself. I appreciate the work you've done, but more significantly, the work that you are the catalyst toward achieving. Thank you very much.
Thank you.
Mr. Murkowski.
Thank you, Chair. And I will say we had a thing planned for Cindy today. We're going to do that under my announcements after the public health update this morning. So if it's all right, and I'm sorry that we missed the opportunity to sort of do this setup before all the commissioners were able to make comments. And I'm glad that Cindy was able to do that as well. But I had some background information. I think, given Cindy's role and the incredible job that she's done here in Lane County, it's worthy, if it's all right now, to just take that time for a couple minutes to provide you some of the background. Cindy, at age 23, graduated from the nursing program at the Oregon Health Sciences University in 1978. So there you go. We just exposed now your age and everything, Cindy. And began her career in public health nursing with Commissioner Sorensen, the Coos County Health Department. Along the way, she also earned a nurse practitioner certification from UCLA. And you're going to hear this, a lot of travel and work across the country. In 1983, she and her husband, Kurt Wurst, moved to Idaho County, where Cindy worked in the health department clinics, providing immunizations, physical exams, and family planning services. In 1991, Cindy and Kurt moved their young family to South Carolina, all the way across the country, where Cindy earned a Master of Science in Nursing degree from the University of South Carolina. In 1993, the family moved back across the country, this time to Montana, where Kurt worked for the Forest Service and Cindy led the Sanders County Health Department, a job that lasted almost 20 years. Sanders County has a population of 11,000, and I'm told that Cindy very likely knew all 11,000 of those people in Sanders County. And then it was back to Oregon, finally in 2012, where Cindy joined the Lane County Public Health team as a communicable disease supervisor, and probably started buying season tickets for the UO women's basketball team as soon as she settled in. Big women's basketball fan Cindy is. In 8 years, Cindy has overseen a communicable disease program that has grown and developed in response to the needs in the community, including expanding services and prevention programs related to sexually transmitted infections, including HIV, and ensuring access to vaccinations. As a nurse practitioner herself and a public health nurse with decades of experience, Cindy provides expert clinical guidance and support to the nursing staff in identifying and treating infectious diseases and so much more. Late in the day, especially Friday afternoons, you'll find Cindy with a group of communicable disease staff informally gathered in her office, reviewing the day's events and maybe even planning for weekend tasks, reviewing labs, disease investigations, the on-call schedule, and laughing a lot because Cindy has a great sense of humor. And for those of you that know Cindy, she just has this incredible and wonderful, outgoing, bubbly personality that's really infectious in a good way, right? So she's spreading, while stopping the infectious communicable disease and communicable diseases, she's spreading joy and humor in the workplace, which is a great thing for the tough work that they do in CD. She's helped to create an amazing team of public health professionals, not surprising given her approach and demeanor. They enjoy their work. They trust each other. They work exceptionally hard to care for individuals in the community. And we've seen this, of course, in the past 5-6 months in and of itself. Cindy's also developed effective collaborative relationships with healthcare providers, emergency responders, school health staff, managers of long-term care facilities, and many others throughout the county who often call on her with questions or problems to solve. She's co-chaired the statewide Communicable Disease Committee for the Coalition of Local Health Officials for several years, and as a leader in public health nursing is often called upon when expertise in public health nursing is needed at the state level. Cindy's long experience in public health and supervision, combined with her warmth and humor, have also made Cindy an invaluable resource to public health supervisors and managers who regularly seek her out for feedback and advice. Other staff also seek out Cindy for advice and support, particularly staff in environmental health who work closely with communicable disease on outbreaks and other environmental health investigations. And I'm told that any picture of Cindy would be incomplete without also mentioning that she has a reputation as a compulsive fridge cleaner and composter. She collects vegetable scraps from the third floor break areas at Charlton and coffee grounds from the shop on the first floor in a large red plastic bucket. Of course, our waste management and recycling folks are very happy to hear this. And she is also, her team knows that she is a knitter, which I'm sure has come in handy with all of the need for homemade masks recently. And until the pandemic, she was a committed public transit traveler. She carries that red bucket on the bus. She's a thrift store treasure hunter.
That's
and
right.
is well regarded for her expansive and fun shoe collection. Cindy has seen the communicable disease program through many adventures and outbreaks, including the meningitis outbreak at the University of Oregon in 2015, and now, of course, COVID-19 pandemic. Late afternoons in Cindy's office will never be the same. We'll miss her confident direction and her laugh. And the sight of her walking to the bus stop with her red bucket. Cindy has created a strong, well-prepared team who, with her support and training, have the skills and expertise needed to continue to contain COVID-19 in the community, and who will manage community-wide vaccination when a vaccine becomes available. And I want to just share with the board, before I turn it back to you for comments and to Cindy for comments and other things, if you want to say any more. Recently, I had the opportunity to chat with Cindy a little bit at a brief gathering that we had, socially distanced, of course, at the Charlton building, where we were recognizing the folks who have dedicated the past 4 or 5 months of their lives to working in our emergency operations center and the COVID response effort. and I was sitting with a group of folks, socially distanced there in the room, other public health officials, Dr. Ludke, and Cindy walked over to me and she said, I just wanted to say hi and ask how you're doing with all of the stress and everything going on, right? So she comes up to me and asks me how I'm doing when she and her team are the ones who are leading, I mean, round the clock, this effort and response in the community. And she came with just the typical friendly, light, bubbly personality that really is infectious. And it gives you an example. Commissioner Bozovich mentioned that she called out her team. That's just the leader that she's been in the time that she's been with Lane County. And I'm sure in her years of service across the country that she's provided. She is truly going to be missed, not only for her technical guidance and expertise, but for the way in which she has led her team with good humor, with collaboration, and with positive support and reinforcement. So Cindy, on behalf of our entire organization and community, I'm very privileged to share these words that were provided by folks that work daily with you. I want to thank you for all of the great work that you've done, and we wish you all the best for a well-deserved retirement.
Oh, thank you. Thank you so much. I appreciate those kind words, and for people remembering all those things. Yes, my red bucket and shoes, that's correct. So.
Well, thank you so very much. You deserve a clap from me. You will so certainly be missed, and we have some large shoes to fill. Thank you for being able to come up on the screen.
Thank you.
That's great. Commissioner Farr.
Since we expanded, Chair Buck, I will say one thing. It's the greatest praise that I've seen for Cindy. And it's not from any one of us who spoke today. It's from Sue Sierra Lupe, who runs Occupy Medical. Cindy, remember this as you go into retirement. Sue's words, you are a dream come true. Take that with you.
Oh, thanks.
Commissioner Bernie, did you have your hand up? Nope, we're good. Okay, well, thank you so much. We'll miss you around the office.
All right, thanks. Well, I leave behind a great team, so whoever comes to fill these shoes and fill this chair has a gift that I'm giving them, and that's this wonderful team in CD. And a big job during a pandemic, but so. All right, thanks, Chairman Buck, Chairperson Buck, excuse me.
Thank you. Okay, well, we will move on to county administration with our COVID-19 response and recovery. Mr. Mokahysky and Ms. Karen Gaffney.
Thank you, Chair. And Karen is here and she'll provide an in-depth update as we do each week for you. I wanted to just tee up a couple of things. Commissioner Sorensen brought up the need for planning and for plans. And I wanted to just articulate for the board, and certainly we're open to if there are ways in which we can better communicate the plans that are in place, certainly open to that, or if there are ways that we can share this with the board and the public and document it so that it's clearly understood and reflected in all that you do. Happy to do that. Commissioner Sorensen's right. We have a strategic plan, and we waive our laminated strategic plan as a set of priorities and goals that we focus on. I want to make it really clear to the board and to the public watching that we have a very robust and detailed plan for managing COVID-19 in our community. As we just discussed with Cindy and the public health team, our public health staff, and we've had an emergency operations center running since mid-February. So we're going on 6 months here of emergency operations work. We are working really aggressively right now to develop a 3-tiered cycling plan so that we have actually 3 different teams, red, white, and blue team within our emergency operations center that will spend 2 weeks on, and then they rotate so that we keep people fresh. As you can imagine, 6 months of managing a global pandemic in terms of the emergency response is a grind, and we're nowhere near the end of this. And so we're making sure that we're not only managing the effects in the current moment, but setting ourselves up for success in the long term. So I wanted to touch just on the 5 broad areas that we are focused on. And we began reporting these to the board in April. So we've been providing updates for you on this. And again, happy to, if we want to, provide develop a laminated sheet of these 5 goals. And we have metrics on many of the areas that we report on each week for you. Some of the things, such as how often are how many people in the community are wearing masks, we won't be able to do, but certainly in terms of testing and contact tracing and all of those things, we're collecting robust data. I'm reporting on that on a daily basis with all of our employees and with our community partners. And then we report here to the board. You receive the situational updates from our EOC, and we report to the board in public on a weekly basis. So the 5 areas that we're focused on that Karen can walk in more detail if you'd like through are 1, containing the spread. There are 5 specific areas that fall under containing the spread, and these get at testing, tracing, isolation, and other areas. So that's 1 is containing the spread. 2, identifying and providing health provider needs. So the health provider community, whether that's PPE, equipment, information, or other things that are needed by the healthcare provider community, identifying and providing the needs for the healthcare provider community. 3 is identifying and providing economic supports for residents and businesses. You've heard a lot about this as it relates to renter support and unhoused community and business supports. 4 is public information, and so this gets at education and the daily news briefings and news releases that we put out, the information campaigns and advertisements, regular communications with various stakeholder groups in the community around public information. That's 4. And so 5 is preparing for the fall. And that gets at particularly 3 specific areas, working with our higher ed community in how they're handling classes for the fall, working with our K-12 schools, and then working on developing plans for the unhoused, part of which you will hear tonight in the joint session with the city of Eugene. So again, those 5 areas: containing the spread, healthcare provider or health provider needs, economic impacts to residents and businesses, public information, and preparing for the fall. And then there's a great deal of detail under each of those 5 that we've identified. But I just want to make that clear that we have had this robust plan, and the plan is also, as our strategic plan is flexible. So we understand that these needs are the guidance from the state changes oftentimes on a weekly basis. And so we're needing to adjust and flex our planning in order to meet those changing guidelines and regulations and the changes of the virus in the community. I know Karen is going to walk through the disease in the community. We continue to monitor this and report on that. I will just, again, as I oftentimes say to folks, we'll report on the total cases, but really importantly, I think, is tracking infectious cases as of yesterday. And Karen may have a more updated number. We had 38 infectious cases in the community. That was a drop, and a significant drop if you just look from a week ago. Hospitalizations are remaining flat for the moment. Our deaths, we have not seen any change in. Our testing numbers continue to be at or above what we have targeted. And our sporadic case rate continues to be below the state average. So those are all metrics, in addition to a lot of other data points that we're tracking and provide more information on. We just want to make sure that the board understands and the public understands that there's a significant amount of both of infrastructure, planning, and execution work that continues to go on in managing this work in our community. So Karen, you want to take it from there?
Thank you, County Administrator, Chair Buck, and board. Before I dive into that, I just want to take a moment to thank you for your appreciations for Cindy Morgan as she transitions to her next great adventure of retirement. And I just say I was sitting here at my computer and had to smile because I think the way that played out was a perfect example of what public health is like. We just roll with whatever happens, and we gave her a great send-off and appreciation, which was certainly, I know, Steve and Jocelyn and my intention to make sure that she was recognized for all of her great contributions. So thank you for that piece. And it is a tremendous team in public health that has been working and around the clock to make sure that we contain the spread of disease. So maybe I'll start by talking a little bit about approach and the plan to tee off of what Steve talked about, and then kind of do a little bit of a deeper dive in our usual areas of reporting. I do think it's important for the community to know that we absolutely have a plan. We've been operating under our Emergency Operations Center Incident Command structure since February, and we do we have weekly plans and goals and tactics, and that those need to change and respond to what is changing in the community. And we expect that that's going to continue. The science is continuing to evolve related to COVID, and we absolutely will adapt to that. And it's important that the board know what our general way forward is, and that's what Steve described in terms of those 5 elements of our focus. Moving forward, particularly into the fall and winter. So I'm happy to talk about in a deeper way any of those areas. I know the particular metrics that the board has asked for regular reporting on tend to be in that first category of how are we doing on containing the spread of disease. And so I have some data for you there. And then our impacts with the business communities and individuals. And then finally, I've tacked on an update about schools just because I know how critically important that is for the community. So that's my plan for the presentation part today. And also, the other part I would say at a high level in terms of our approach to addressing the pandemic in our community, I would say, first of all, we've been very science-based and focused on the data as that evolves and incorporating that into our work. We're also really clear that we're part of a larger statewide effort. And if we can collaborate both at a policy level, at a systems level, and even at a tactical level with the state on items like PPE and testing, then we're able to amplify our efforts in the community. And also, I think it helps minimize confusion for people in our community about what the current guidance is and what we would ask of them. So we're working very hard to maintain that alignment as we move forward, and we expect to continue to do that. And then I would also say we've incorporated strong collaboration with our partners in the community as a key part of our approach. The University of Oregon in particular has been a great partner with us and bringing their resources to bear in being able to organize efforts and partner with McKinsey-Willamette Hospital. I think every opportunity I have, I really want to tip my hat to them. You might recall at the beginning of the pandemic, before McKinsey-Willamette was able to have their lab up and operating, we were completely dependent on outside labs for testing. And we can see, again, as nationally cases have increased, that has a huge impact on turnaround time. And so to the extent that we can have McKinsey-Willamette as a local lab on board, that makes a huge difference for us. And then the other key partner I would call out right now in our work is schools and K-12. So I'll talk a little bit more about that at the end of my report. So back up to how is it that we are working to contain the spread of disease in our community and essentially flatten the curve. We know that we will not be able to eliminate COVID-19 and infections in our community before we have a vaccine. So our strategy is to flatten the curve, keep the numbers of cases low so that we don't stress our public health system, and so we can keep serious illness at bay. So that has been the goal for the last several months. That includes general precautions in the community, the hygiene, wash your hands, physical distancing, please wear a mask. And we've added to that, reducing travel is really critical of what individuals in our community can do to help contain the spread of disease. We counsel higher risk people, please still stay home. Even though we're in phase 2, that is part of the guidance. If you are at high risk, stay home and stay safe. The cases in our community as of this morning, we have had, since the beginning of the pandemic, a total of 464 people who have tested positive in our community or who have presumptive COVID. Currently, as of this morning, we have 35 people who we consider infectious. So that's really, as we're tracking the current situation in the community, as Steve said earlier, we are really focused a lot on that number. And we have 2 people this morning who are in the hospital. We have seen over the last week that our number of new cases has started to decline, and our number of people who are infectious, which is connected to that new cases piece, has also been declining, which is really great news for us in the community. Our test positivity rate, which is one of the other indicators we use in terms of the prevalence of the disease in the community, our rate was at 1.6%. So of all tests conducted, 1.6% were positive, which is still well below the state average, and we want to absolutely maintain that lower number. In terms of testing, this is one of the areas where early on we set a clear target. You may remember at the beginning of the pandemic, we were struggling to be able to successfully have 100 tests a day, and set our goal of making sure we had 500 tests a day in the community, and steadily worked up towards that. We are now, the last 2 weeks, have averaged well over 700 tests a day. And in fact, there have been, I was looking at our information on the website, we've had more than 5 days where we've exceeded 1,000 tests in a day. So those numbers continue to increase, which is exactly what we want to have happen, and we'll continue to promote that increased testing capacity in the community. We have had over 38,000 tests completed in Lane County, and OHA at a state level, the health authority, continues to receive widespread reports of extended turnaround times for commercial labs, which is what I referenced earlier, those labs that go out of county. And in some cases, we've had results delayed even up to 2 weeks from specimen collection. So it's critical for us to be able to get that capacity expanded so that we can get faster turnaround time. And those longer turnaround times are largely impacted by supply shortages that are of concern, and really driven by the huge spikes of cases that are happening in other parts of the country and in other parts of the state that are diverting those resources. I would say also, in terms of testing, you'll recall, in addition to the community lab testing that's happening through providers, Lane County Public Health is doing surveillance testing. Last week, we conducted 7 testing events and tested approximately 130 people across those different events. This week, tomorrow afternoon from 1 to 5 is our second reservoir testing event here in the Eugene Springfield area. It will be at the Lane Events Center, and it's targeted for what we're calling essential frontline personnel. So that would mean people who have been working throughout the outbreak in many of the service industry jobs, grocery store workers, gas station workers, customer service reps, food and coffee service workers, people who can often be low wage earners and not have ready access to healthcare. So we want to make sure we are testing for COVID in those populations. So we'll be set up at the Lane Event Center tomorrow afternoon for that. And we will continue to also target our efforts, surveillance efforts, to determine spread among our communities of color and other marginalized communities. And we continue to regularly test at Lane County Corrections and at sponsors because we know that there's high-risk populations among our prison population, and we want to make sure that we identify that early. So that's our status around testing in particular. The testing is important because it triggers contact tracing. And I know nationally, we've learned a lot about public health in the last few months. Contact tracing is something that has been a core part of public health since I've been working here. It's our way to immediately reach out to people who test positive for COVID and talk to them about isolating during the course of their infectious period, and then also get information from them right away about who they have had close contact with during their infectious period, and then reach out to those individuals as well and monitor them for symptoms. As of Monday morning, our contact tracing team, and we have a team that works here out of the Charnelton building, and then a team at the University of Oregon that's working with us as well. So combined, we were monitoring 342 people in the community who have been contacts for COVID. That team consists of 123 people. That's a combination of staff, volunteers, and U of O students who we have trained as contact tracers, and they're available to deploy if needed. Last week, we used 57 of those people. That was 9 staff, 33 volunteers, and 15 U of O students to help with contact monitoring. And we continue to hit 100%, which the benchmark from the state is 95% of people contacted within 24 hours. So I'm particularly proud of bringing that team together and being able to respond and ensure that we get people in quarantine and isolation quickly. It will be an important part of our effort to contain the spread. You've also asked me to update you on hospital usage. And as I said earlier, we have 2 Lane County people who are currently in the hospital. We do have regional hospitals. So oftentimes there are people from other counties who are also in the hospital in our community. So we do monitor both the Lane County residents there as well as the general hospital capacity. And I'm pleased to report that our hospitals are in good shape. We don't have any of our folks in the ICU right now or on ventilators, but the hospitals are prepared to surge with that capacity if it's needed. When the county administrator talked about our overarching 5 areas of focus, one of those was certainly to make sure hospitals and healthcare providers have what they need. So we continue to monitor our PPE supply in the community. We have a stockpile that we are managing here at Lane County, and using a combination of pulling materials down from our state stockpile, as well as purchasing where we need to and can purchase to make sure that we have a supply here if things get tight in the community. Pat Dotson is our senior stores clerk in public health, who has done just a really great job of monitoring that system for us. Also want to talk a little bit about businesses. So I'm going to give the general financial business report, and then I also, Commissioner Burney, have an answer from your question from last week that Austin has and his team have pulled together. So the business grant program, you may recall, we've been reporting the last several board meetings in response to Lane County's application for round 3 of the Business Oregon Emergency Business Assistance Match Fund. We were awarded an additional $400,000 to be provided as grants to eligible businesses. There was a little confusion. The initial announcement had talked about a higher amount, but we got the corrected information. It's actually a $400,000 grant, and that's in addition to the $225,000 that was awarded from rounds 1 and 2. Those funds are going to be invested into the current grant program with Community Lending Works to fund that wait list of businesses who were unable to receive funding from prior rounds. Also, I think a bright spot for us has been the opportunity to look at rural broadband expansion with some of the COVID money, and the need has never been more clear than as we've pushed to remote working and telehealth and other things that really rely on broadband access. Lane County worked with several communities and providers to support applications to the Business Oregon Rural Broadband Fund. It was a very competitive it was extremely competitive in terms of those proposals, but we did have 2 projects that were awarded. The Douglas FastNet received funding to complete fiber builds in Crow Applegate Lorraine School District that will support residential broadband and remote learning. And then the second was Emerald Broadband received funding to complete fiber builds in the Fern Ridge School District area, again, to support residential and remote learning. So those are both bright spots for us. So last week, Commissioner Burney asked if there was a database where we could get information about which businesses in our community had received federal assistance to date. And what those amounts were. And I will say staff have worked very hard to try and come up with an answer to that. The short answer is there is not a simple way to do that. However, Jenna Cusimano on our staff has combed through the small business, why am I losing what the A is for?
Administration.
Database. Thank you, administration. It's a team sport memory these days. The SBA database to individually identify each of the PPP recipients in Lane County based on their address. And what she found is a total of 4,084 businesses in Lane County have received PPP loans of $150,000 or less for a total of $156,227,445. A total of 802 businesses in Lane County received PPP loans of $150,000 or more for a total of 303 $100,000 million to 735,850,000. And the notes they sent me is that SBA reports in ranges for loans from 150K or more and not exact amounts. So that's why there's a range there. So that is what we learned in answer to your questions. EIDL data has not been made available by the SBA yet, but we're hoping to see it in October. And those resources have been much smaller than what the PPP program made available to businesses. And we do not have similar data from the state yet, as much of those resources have only recently hit the ground. But our staff and economic development will continue to monitor those things. It would be great if there was a simple database, but apparently it has not yet been created. There's an update, Commissioner Burney. And then finally, before I turn it over to questions, want to update the commissioners on progress with schools. And in particular, K-12, I know has been a significant issue of concern in the community, both for parents who are struggling to know how to plan for the fall and wanting to make sure that their children are in the best position possible to have a high quality education. And then also for employers and businesses and those same parents who are trying to make plans for parents of school age children who may not have other daycare arrangements and trying to plan around that. We have continued to have calls twice a week with our schools, open to superintendents and other staff as they work on their plans for the fall. Those are due by August 15th. Some of them, I think, may choose to submit those earlier. Last week, we heard that the Department of Education is planning this week to release some specific metrics to schools that will help give them information on when and how to move from the 3 different stages of opening. Whether, if we assume on one end of the continuum is complete remote learning, in the middle would be a hybrid system of either schedules by days or by weeks for children to be in the classroom some of the time, or for some children to be in the classroom while others are remote learning. So that hybrid system, or the other end of the continuum, which would be complete in-classroom learning. So schools are able to propose plans to start at any of those 3 stages and need to recognize that based on how the disease moves moves through the fall and winter and into the spring, schools need to be prepared to move between those levels. So everyone needs to be prepared to do remote learning if that's necessary. And if they would like to do hybrid, that certainly is an option. So the metrics that will be coming out from the state will give guidance to schools about under what conditions are they able to have children on site in school. So the disease needs to be contained enough to be able to have it be safe for reopening of schools. So that information should become more clear this week as the Department of Ed releases that information. So as I wrap up, I want to finish thinking about schools and for those in the community who are watching this report today, from a public health perspective, as well as a community member perspective, I think there's very little that's more important to the future of our community than our children. And we absolutely want to make sure that they're able to get the very best education they can as we move through this. So the way we're going to be able to support our kids and schools is to make sure that we each do our part to contain the spread of disease in the community. There are very concrete things everyone in this community can do in order to make it better. And that means please maintain social distance, even though it's summer and you want to be together and you're tired of the virus. This is the time to just dig deep and do your part in making sure that we contain the spread of disease. So please wear a mask when you're with anyone outside of your household, and do that physical distancing. Forgo, the baseball tournaments, the barbecues, those other things that maybe we can miss for one summer, in order to make sure that we contain the spread of disease and are able to bring businesses and schools back in the way that we want to do that. So I think, Chair Buck, I will turn it back to you at that point.
Thank you very much. Any questions or comments? Commissioner Farr.
Thank you. I jumped in first to allow other folks a lot more time than I'm going to take. Karen, first thing I'm going to say is I'm disappointed. I'll tell you in a few moments what I'm disappointed in. But first, I want to thank you for the quote, very detailed and robust plan that you have in place. That's a quote, end quote. And thank you for giving us the details of it, including the 5 points of the plan. Much of the information that you talked about is available to the general public and to us by clicking on Lane County's website and going to the very top banner, which is coronavirus, and digging down. You also mentioned, Karen, that collaboration with the state helps minimize confusion regarding the general public and how we are moving forward with the recommendations and with our restrictions, etc. You said that last week also in response to a question regarding whether or not we had declared recovery. So I think you continue to say the same thing. Collaborating with the state reduces confusion, and I will hang my hat on that. I want to thank you for the very quick response that you gave to me on a side question regarding from MWMC. I asked you about testing the flow of wastewater, and you gave me a very detailed response. I didn't need to usurp any time at this meeting to talk about the response, but thank you for getting that to me, and I'll forward that to MWMC to answer their questions. Karen, I'm going to go to our website. Our website has a great deal of information with just a couple of clicks, and much of the things that you're talking about today are updated on a regular basis, and I find a lot of my information on a regular basis right there. In addition to the fact that you provide almost daily reports on the local situation, and that Mr. Mokrahajski provides almost daily reports on the situation. What you tell us today is direct answers, of course, to Commissioner Bernie's questions, and more anecdotal response that we're able to take out with the community. And
Can't hear you guys.
I can hear you. The one thing that I will say I'm disappointed in, Karen, I'm clicking on our website right now, and I clicked on the top banner, and I got to 2019 novel coronavirus COVID-19. The top circle says, click here for the latest testing and patient data for Lane County. The thing I'm disappointed in, Karen, is that it's not been updated since yesterday. What is wrong with y'all? No, that is absolutely a joke. I'm not disappointed. You're providing absolutely timely information. Many of the questions that you have from us, you've already answered. If we just take time to look at the website. Thank you.
Thank you. I just want to pause for a moment to see if Commissioner Sorensen's audio is back up and running. Commissioner Sorensen, can you hear us? Doesn't sound like it. Perhaps he might need to log on and log off and log back on. Sometimes our platform is having connection issues, as we did last week. I'll continue with some comments and hopefully we can get him back on track. Any other questions or comments? Commissioner Bozievich.
Thank you. I'll just say that if I could ask for one thing to be added to the Tableau front page on our daily coronavirus information is the number of infectious cases. I got asked that question and I went to look to try and answer it. I ended up having to copy and paste our daily press release to somebody so they could get that number. It's not easily available on the website. So just one data point I'd like to add.
And Chair Buck and Commissioner Bozievich, I just went in and refreshed, and I think we have already met that need for you. We did a little bit of an overhaul on the website last night, and so I think you'll be able to find that now. I agree that's an important piece of information.
Great. And then I will remind you there were some questions I asked about mortality rates and tracking and all that, but I assume you guys are still researching that and we'll get an answer later.
Yes, Dr. Ludke, I have sent those questions over to him and he is working to pull information both from the medical examiner. We also need to get some from vital records at the state, and with COVID, they're a little bit behind. So, but we do have that scheduled for a future agenda item.
Commissioner Burney.
Thank you. Karen, just a bit of it. We all received a note during your discussion that at 3 this afternoon, they're having some statewide school reopening metrics Q&A. I think you were referring to that. Excuse me. Last week, I asked you some questions and you mentioned that you were convening a meeting of all the school board of education members in Lane County. I asked if you could invite me to that. I've heard nothing. Could you maybe offline tell me when and all of that, because schedules fill and that's of great interest to me. Is that still scheduled?
It is, Commissioner Burney, and I can send you the information if you wanted to be an observer on that. It's just an hour long,
Yes,
and I'm not certain how many the school board members will come, but I will let you know when that is. Yes.
Thank you. I know we have no authority, nor should we, over school board members. I have been a school board member for well over a decade in the past. I cannot conceive at this moment of anything more close to the heart of any parent or any teacher or any family of any child in school about this issue. And I don't see the issue being access to a high quality education right now. I see the issue being, are schools going to open or not? And what's that going to look like? And am I comfortable putting my child in that environment based on what it's going to look like? And are teachers comfortable teaching? I would be very interested in how many school board members do attend, because I cannot conceive that there would not be full attendance from every school board member in every district in Lane County. This is the big elephant in the room staring us in the face at this moment in time, from my perception. And as we've also seen, there's levels of comfort no matter what laws allow or don't, or what phases of opening we're in. Really, the bottom line is, are people comfortable participating and engaging. So I'll stay tuned to that. Karen, you mentioned, I'm changing the subject, two quick other subjects. You mentioned something that I found phenomenal, which had to do with the contact tracers, which are trained and prepared to be deployed as needed. And you said 95% of the people contacted within 24 hours that have been with people that had COVID. In this county, what's the turnaround rate? I get a test. When do I find out the result?
Thank you, Chair Buck and Vice Chair Bernie.
Which I haven't yet, by the way. I'm sorry.
It depends on where you go for your test. And what we have found is the labs where specimens are sent out of county, they're saying 7 to 10 days for a result. I know we've had some that have taken longer than that have been 14 days. So there's definitely a problem with turnaround time at those labs. If you are using McKinsey-Willamette here in our community, the turnaround time is closer to 24 to 48 hours. And again, it depends a little bit on what the run looks like on any given day, but that's been generally true with McKinsey-Willamette.
So thank you, Karen. Correct me if I'm wrong. 7 to 10 days, isn't that kind of moot? I mean, if I've lived for 7 to 10 days and come in contact with people, what good is that test?
Well, what does happen, and I think this is consistent across providers, is if your provider is concerned that you might have COVID and so orders a test for you, they're also at the same time going to ask you to isolate yourself and assume that you have COVID. And so you're going to stay home, you're going to stay off work, you're going to do all of those things as if it were a positive test. That certainly is the counsel that providers are giving to people so that we're still able to contain the spread of disease. It certainly hampers our contact tracing. Absolutely. Because if we don't know until 10 days later and then talk to you about who you've been with, we haven't been able to isolate those people.
And have you heard about the new COVID-19 test Abbott Labs is approved for that has a 5-minute turnaround time? And if so, are we mobilizing to make those accessible throughout testing points in our community?
I appreciate the question about rapid testing.
Well, this is a specific one. I mean, this is approved, ready to go.
Okay, and I will need to ask, I don't know, I've heard about a number of different tests, so I'm not sure about that specific one you're looking at. What I know is Lane County has been back ordered for Abbott ID9 testing platforms. We've had 6 of them on order for a couple months now, and they haven't been shipped. So we can decide to mobilize and buy it, but actually having it delivered into our community is something that we don't have control over. So I'm excited about the work that the University of Oregon is doing, and I know there's been some coverage in the media of being able to get an FDA approval for a saliva test, which they would be able to have very large runs on every day. And if we can get that FDA approved, then that will be a complete game changer.
It'll totally. I can't imagine how excited we are to try and have that occur, and how frustrating it must be for you to know what answers are and be unable to access the resource to implement right now. And last thing, if I could, Karen, could you share again, in terms of the dollars that have been injected into the Lane County economy? And by the way, under these circumstances, the turnaround time where they just keep getting re-injected into the economy is very high. There were 2 categories, right? One was PPE loans of $150,000 or less. And what was the total amount that Lane County businesses have received for that piece?
The total for that one was $156,227,445.
And thank you. And the other piece, which was 150,000 or greater total into the county.
One where there was a range on this. So it was, because we don't have the exact dollar amounts, it's somewhere between 303,100,000 up to 735,850,000.
Thank you very much. That is significant. I mean, the top of the range is almost $1 billion has been pumped into our economy as a result of all of this. And it sounds to me like some larger corporations, probably a few, have gotten a lot of money, and it's been spread out. When we have another 400,000 to give to businesses locally, do we make sure that money is going to businesses that have not already dipped in this? So we're trying to equitably spread that around, or is that something the data just doesn't allow us to do?
That's a great question, Chair Buck, Vice Chair Berney. Austin, when I spoke with Austin Ramirez, that is absolutely an issue for those 400,000, is that those are an eligibility criteria is for businesses who haven't already received other federal resources.
Ms. Gaffney, Chair Buck, thank you very much.
Absolutely. And before I go to Commissioner Sorensen, I just wanted to add that I did get an alert that Governor Brown is going to have a press conference at 1:30 today to talk about school health and safety metrics. In addition to that, there's a 3 o'clock virtual meeting with commissioners, and I believe the governor about those reopening metrics. So hopefully we'll learn a lot more about that today. Commissioner Sorensen.
Thank you. Can you guys hear me and see me?
Yep.
Okay, good. I'm sorry, I did have some technical problems there for a while, so I didn't catch all of the questions and answers, but I provided Ms. Gaffney with some of my questions for this week, and I get it that there are these general guidance that we are pushing, such as people washing their hands, wearing a mask, staying socially distanced, and if they are in a risk category, to stay home. And I gather also that we have a goal of 500 tests per day. Is that goal written in a plan somewhere, that 500 tests per day? Is that a goal that we have put down on paper or put on our website or made, okay, Lane County's goals to attack the COVID-19, one of our goals is to have 500 cases tests done per day. Is that Karen? Am I understanding that correctly?
Chair Buck and Commissioner Sorensen, I believe that was written down in the blueprint when we applied to move to phase 2. I know the 100 is absolutely in there, and I believe we referenced that our goal was 500,000 or 500 tests a day.
Are you saying that the blueprint for reopening, going from phase 1 to phase 2, that's really our plan? Is that our plan, the blueprint?
No, I was saying that's where we wrote down the goal of 500 tests. I would say that the blueprint reflected what our plans were for moving into phase 2, and it describes what the indicators were, the triggers, if you will, of what would concern us in terms of being able to stay at phase 2. So those metrics are contained in that plan there, but I would not say that that's our comprehensive approach is not completely contained in that roadmap.
Okay. Is there a reason that we selected 500 and are there other goals besides the 500 tests per day? Are there other goals that we have, whether they're buried in either the blueprint or in an email or not in the Lane County strategic plan, but is there a place where we could say, okay, these are our goals. We got 1, 2, 3. We got 1, we're going to do 500 tests per day. 2, we're going to have tests. We're going to have contact tracing within 3 days that we learn of an infectious exposure, or or we're going to have tests back from the provider in 3 days or 5 days. Are there other goals besides 500 tests per day?
Commissioner Sorensen, I think maybe what you're asking isn't so much goals, but metrics for how we measure that. I would say that in terms of the goals, absolutely, it's the plan that the county administrator outlined at the beginning of this agenda item that describes each of those goals and objectives. So that exists. We do not have it posted on our website, and I think that's what the county administrator was talking about. We absolutely can be more transparent and send that to you. We haven't done that.
Is that something that is, in other words, I really appreciate you putting it on the website. That would be extremely helpful, not only to me, but other people that are concerned about the fact that we have infectious cases in our county. And in no way are these questions meant to be a criticism of what the valiant work that's going on. I'm just pointing out that if there are other goals besides 500 tests per day, I think it would be helpful for us to know what those goals are. And if there are other goals that will lead us to 0 cases, what are those other things that we need to do? And the terminology here may be getting in the way of things, but what I'm pointing out is, and maybe you could clarify that, what other things like the 500 tests per day, whether we call it a goal, a strategy, a measurable tactic, whatever it is, what kinds of things besides 500 tests per day are you trying to meet right now? What are you trying to meet? What are those measurable things? I won't say goals, but things.
I would start by pointing you to the gating criteria, those metrics that get updated once a week. That is a key place of our dashboard to be able to see how we're doing, both compared to other counties and the statewide average. So that includes things like how quickly the percentage of cases we've been able to follow up within 24 hours. And that was one I cited in my presentation. The statewide target is 95%, and we've met that each of the weeks that the health authority has published that. We look at our percent of cases not traced to a known source. So that's, I believe the county administrator in his remarks talked about sporadic cases. So sporadic cases are those that can't be traced to another source. So that's a key metric that we look at. We absolutely look at our percentage increase in new cases. And we don't want to see that increasing more than 5%. We look at our positivity rate in testing. Again, that's not necessarily a measure of our specific performance, but is really looking at the community as a whole and how prevalent is the disease in the community. So those are some off the top of my head, I would say, are on the dashboard that I'm looking at each week.
And those data, are they released to the public? Are they on the county website?
Yes.
Yes. Okay, good. Thank you. And then another question I have was, have you taken a look at what Bend has done on their enforcement of of a local ordinance? And have you concluded that we shouldn't have a local ordinance dealing with mask requirements or social violation of social distancing rules? Have you basically, you just don't want to go there? I don't want to put words in your mouth, but like, I don't want to go there, but what is your view on having like Lincoln County, which is an unenforceable guidelines to the public, where Bend, the city of Bend, has put infraction type penalties, 100 for a first, 250 for a second, 500 for additional infractions. And also they have kept the government out of filing these. They can't be filed by the government. They have to be filed by members of the public or businesses that see violations. What have you rejected that idea?
Chair Buck, Commissioner Sorensen, I will tell you, I have not looked at the specific language of the ordinance in Bend. I know we talked last week about the resolution in Lincoln County and that was adopted by Lincoln County prior to there being a statewide masking rule. So I do think if there's a statewide policy.
It's not a rule, is it? It's a guideline. It's not a rule, right? You said the statewide rule. It's just a guideline,
in terms of wearing masks?
Yeah.
I would say it is yes, it's billed as a guidance. It theoretically can be enforced, but I think everyone's been really clear that the police departments, state police and other local police departments probably have other things they need to spend their time on.
It's not a rule. It's not a rule that we can enforce. It's a rule that somebody else could enforce, maybe, but it's not something that we have any authority over whatsoever.
Commissioner Sorensen, I would disagree with the whatsoever part of your statement. I think that in terms of the governor's guidance, enforcement falls in several different places. So for instance, and it falls to whomever licenses particular entities. So to the extent if there was a restaurant, so Lane County Environmental Health is responsible for restaurants. So if there are complaints about restaurants, those would come to us and we have a role in that. If there are complaints about employers, those go to OSHA. If there are complaints about bars and restaurants, those go to the OLCC to enforce. So, so we certainly are not responsible for all of the enforcement, but there is a piece of that that is ours as it relates to entities that we license.
Do we have any goal regarding the compliance with the mask guidelines? Do we have any goal, like we want to see 40% of people wearing masks, or we want to see 10 or 90, whatever? Is that part of our plan?
I would say, Commissioner Sorensen, that we have not identified a particular percentage, and in part that's because being able to measure that metric is exceedingly difficult. So we could say 75%, but I'm not sure how I would be able then to report to you to what extent we are or are not meeting that goal, because that is something that across Lane County is not really currently being measured. And again, things continue to change during this. And so if that shifts and that becomes a more measurable goal, then we might identify a particular target. For right now, what we know is masks are a really important tool, and we are working to persuade and compel every Lane County resident to comply with the governor's order and wear a mask.
I want to ask you a very specific question. Has Lane County Public Health decided not to recommend enforcement of mask requirements?
I would say that we do not have the resources in Lane County Public Health to do enforcement beyond the pieces that are already delegated to us. And so I have not at this point come to you with a recommendation to hire additional staff to become mask enforcers in the community. But again, things may change as this evolves. At this point, we're really relying on those businesses and the community to do the right thing and to comply. And where necessary, there are enforcement mechanisms available statewide and in the community.
Okay, well, thank you very much. I'd like to keep our meeting moving along. We spent a good deal on this, so I appreciate everybody's thoughts and comments. So why don't we move to our next item, which is our consent calendar. Is there a motion to approve?
Move to approve.
Second.
Moved by Commissioner Burney, second by Commissioner Bozovich. Any discussion? Seeing and hearing none, I'll call for the vote. All those in favor, please say aye.
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 All those opposed say nay. Motion passes unanimously. Thank you. All right, we'll move on to item 7A, Health and Human Services, Order 20-07-28-07 in the matter of approving 5 contracts and 2 amendments and delegating authority to the county administrator to sign the approved contracts and amendments. And with us is Ms. Gaffney again.
Chair Buck, commissioners, I'm back. Yes, we have 2 board orders in front of you today. And the first is specifically for 5 contracts and 2 amendments. Again, typically this would be on the consent calendar as routine business, but when there are new contracts, we tend to put those on the agenda for an opportunity for you to discuss them if you would like. There are, of these contracts, 5 of them are revenue agreements, and as you looked through your packet, you can see those are primarily related to our Human Services Division, our annual collaborative work with the cities of Eugene and Springfield for the Human Services Commission, and it does include some new community development block grant dollars from the CARES Act that are coming through that system. And then our 2 amendments, again, are for services that we regularly provide in the community, a coordination of care agreement with Whitebird and HIV prevention testing and counseling with HIV Alliance.
Any questions? Not seeing any. So I'll ask if there's a motion to approve order 20-07-28-07 as presented.
Move to approve.
Second.
Moved by Commissioner Burney, second by Commissioner Sorensen. Any discussion? All right, seeing and hearing none, I'll call for the vote. All those in favor, please say aye.
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 All those opposed say nay. Motion passes unanimously. Thank you. We'll move to item B, which is order 20-07-28-08 in the matter of approving 1 contract amendment with St. Vincent de Paul and delegating authority to the county administrator to sign the approved amendment. At this point, I will declare a personal conflict of interest as I am related to the executive director of St. Vincent de Paul, a party to this contract, and I'll give the proverbial gavel over to Vice Chair Burney, and I'll close my screen.
Well, now that we've gotten rid of the chair, no, I'm just kidding. This is item 7B, I believe, order 20-07-28-08 in the matter of approving 1 contract amendment with St. Vincent de Paul and delegating authority to the county administrator to sign the approved amendment. Does anyone wish to weigh in? Mr. Sorensen?
At this time, I'd like to move approval of the order as presented.
Second.
It's been moved and seconded, and it looks to me like Commissioner Sorensen is aggressively waving his hand. Yes, sir.
Thank you so much. I just wanted to mention that St. Vincent de Paul is deceased, and we cannot make a contract with St. Vincent de Paul, but we can probably make a contract with St. Vincent de Paul Society of Lane County Incorporated.
I take no responsibility for that. I read this, but so understood. Is there further substantive discussion? Hearing none, I will call the question. All those in favor, please signify by saying aye.
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 Opposed, same sign. The motion passes 4-0, Chair Buck abstaining. Chair Buck, you may resume if you would like, or I can just run with this thing.
Thank you very much. I'm back.
Okay.
We'll move on to item 8 on our agenda, which is County Council announcements.
Chair Buck and members of the board, I don't have any specific announcements, but I know we were going to talk about under this item planning for the redistricting matter.
Yes, let's move to item B then.
Thank you, Chair Buck. Members of the board, you'll recall just by way of background that one of the assignments that I was given was to come up with a process for obtaining public input and engagement in the redistricting process. You should have all received a list of most likely interested parties that I compiled and sent around for your review. But now we're really to the point where we need to be, staff needs very specific direction from the board about what this is, what this work session or listening session, whatever you want to call it, is going to look like. So I'm going to throw out some what I believe are the key decision points for you, which is number one, how many of these meetings do you want to have? Two, what should the individuals who are being invited, and I'm going to sort of put these people on groups into two different lists. There would be the folks that would be invited that were on this, from like the League of Women Voters, Democratic Party, Republican Party, etc. And separate and apart from that, any just general members of the public that might appear. So one of the things to consider is, number one, what is the format when we send out the invitation? Are each one of the groups going to appear individually? Does the board want them to submit written material? Is there a time limit? For example, they get 5 minutes for a presentation and then each group gets 10 or 15 minutes for Q&A with the board. Would the board want to divide these sessions into two, one from those invited groups, another to another that would just be from members of the general public? Again, would that proceed on a public comment format where essentially people would sign up, they would come in, and for, again, given whatever time limits you want to place on it, 3 minutes, for example, give their perspective on what they think should be part of the redistricting process. The reason I'm saying this is that once the board selects the date or dates for these events, I'm going to need to send out the invitation, and that's where I want to be very specific about, you've been invited to this, please submit any written materials no later than X. The process will be, your group will be given 5 minutes or whatever, 10 minutes for a presentation, and there'll be a 10-minute Q&A session from the board afterwards. So really just looking for very specific direction about the structure and how you want these meetings to look and flow.
Thank you. Commissioner Sorensen.
Thank you very much. Well, at the outset, I think for me at least, it's a lot more important to move on the campaign finance front while we have an opportunity to do so. And so I just say, as a matter of some process, to answer part of the process question, I'd like to see the campaign finance work session ahead of this one. But within this one, which I would like after the campaign finance work session, I think that Mr. Dingell's got a good idea here of having sort of the invited presentations versus what I would call public testimony. And I think we should have a public testimony option where people are given 3 minutes at a time certain when we're holding the meeting, where anybody other than the invited people could give comments. So we are opening it up to potentially 300,000 people, but actually probably, maybe 5 or 6 people. And then following the public comment or public testimony, I guess I call it public testimony, we would have the invited presentations. And at this time, unless, Steve Dingell, you've had some responses from anyone other than the League of Women Voters or the Democrats or the Republicans, I think those would be the 3 organizations that would be given an opportunity, maybe 10 minutes each, to summarize their perspectives on it. If there are other people that are invited, I guess I don't have a problem inviting people that have really studied it and really represent a component of the community that would be vitally interested in it. So if that turns out to be other political parties, like the Libertarian Party, which I think is no, I guess it's the Independent Party. That's the third largest political party. So Independent Party of Oregon or the Libertarian Party, which I think now is the fourth in size. I have no problem with adding more people if they have legitimately contacted. And the only people who have contacted me are the Democratic Party people. So I know they're interested. And so I would definitely nominate them. And I would certainly hope that the League of Women Voters and the Republican Party are invited. I don't know if there's other people from other perspectives. I have no problem with that, have them being invited, as long as we know that it is someone that represents a decent, group of people, and all those other people, the Pacific Green Party or the Communist Party or the further to the right than Pete can imagine party, whatever they are, they can come at the public comment session. And so we're not shutting anyone out, but we are zeroing down our discussion with people that have really studied this. So those are my initial comments. Thank you.
Chair Buck,
Oh, yes,
Chair Buck,
sorry.
if I could respond to that. Chair Buck, Commissioner Sorensen, to be perfectly fair, that list was compiled. That is literally just a list. You listed at some previous meeting a number of those folks. And so all I did was put together a list because it was my understanding you wanted to cast as wide a net as possible. None of those individual groups have been specifically contacted and asked if they wish to participate. So I don't want there to be the assumption, because we have not had an affirmative response from the number 9 group on that they're not interested in presenting, because they have not been extended that opportunity. I just want to clarify that.
Okay. Any other comments, ideas, suggestions? Commissioner Brady?
Thank you, Mr. Dingle. It seems to me that this is sort of, the goal here is very simple: a maximum amount of input from the public, because this relates to publicly elected officials, and streamlining that process such that it doesn't overwhelm and actually leads to the conclusion, which I think will be an ordinance followed by a charter amendment. And if I'm incorrect, let me know. But I think that's sort of what we're looking at. So it seems like we just reverse engineer the darn thing. One, I can think of I have not submitted to you a list, sir, so I am not being critical. I think I could generate lists of people that aren't or groups that aren't normally considered political parties that would have a real interest, and at least we should offer them the opportunity to provide, I think, a input written, not testimony, but written, in a format that maybe has 2 or 3 questions that zero in. So we're comparing input on apples to apples. This is just a thought. I mean, I don't mean to get in the weeds. And that we have the ability to look at all of that. Nobody can say they didn't have the opportunity to respond. Everybody that responds has the ability to let other people know that this opportunity exists. And at a specific time, that's cut off. It would seem to me that at that point, we would want some sort of dedicated evening, one of our input sessions, to be dedicated to anyone that wants to give us input on that. Well, and we're looking at sort of an Excel spreadsheet of where the inputs kind of fell from that open process. That to me would lead to a work session. And at that work session, based upon what we got, it would seem you'd develop a format where no one could talk more than 5 minutes, and they'd say their piece, and we'd listen, and everyone would be hearing us listen. And from that, we would develop, our ordinance or our process. But again, to me, the issue really is being inclusionary, so nobody can say they didn't have an opportunity to input the process. I hope that makes sense. I'm sorry if I rambled.
Any other ideas? I will note that September 15th is another evening public comment session. We already have August filled with another presentation listening session. So the next one up would be September 15th, if we wanted to make that an opportunity for people to have public comment on this item. So I just throw that out there. Anybody else have any ideas? Chair Bosevich.
Chair or Commissioner? Yeah. I just, I think it's a good idea to maybe reach out and ask for some written input, as Vice Chair Burney mentioned, from the various parties. And I do agree there may be some other non-political parties that we want to reach out to, just as we are, asking the League of Women Voters. We may want to ask some organizations that represent some of the minority communities to participate, because one of the concerns about redistricting is whether or not it decreases the voice of those communities and all that. So they'll probably want to have some input on the process. I think the biggest thing that I hear consistently is the desire to remove the elected officials from the process and having the final say. That's just a consistent piece I hear over and over again, is not having elected officials pick who their voters are going to be. So with that, almost every solution to that problem is to have some kind of independent body, commission, whatever you want to call them, committee, do the redistricting process, and then have them make the recommendations for the new districts, and then that be the final recommendation, without any sort of ability for the board to change that afterwards. So the questions I might want to ask those various groups and all that are, who would appoint that commission? Who would you trust to appoint that commission? And maybe have some suggested choices like retired judges, retired countywide elected officials, and just have some, who do you want to be appointing that independent commission? How should that commission be made up? Should it be a balance of the two major parties and non-affiliated minor party folks, 33% Democrat, 33% Republican, 33% non-affiliated and minor party? That sort of question is kind of important to people. How does the process work? The statewide initiative basically had people submitting applications, and then retired judges selecting people from that through an interview process, I guess. But those are, I think we could get to some meaningful input, knowing, unless there's not consensus here, I think the biggest reform people are looking for is to remove the elected officials from making the final decision and handing that over to some kind of independent citizen committee. And if we all agree on that, then we can make the questions about who makes those appointments, how's that process work and all, and try and get to some kind of suggested process. But if we're not agreeing that it shouldn't be an independent commission that ultimately has final authority over the boundaries, then we're starting a whole different conversation. But what the League of Women Voters is recommending, and most of what I've been hearing is some kind of independent commission that has final authority. So I guess my question right now is that an agreed upon concept as we march down this, or is that not an agreed upon concept, and then we have a much bigger discussion and specific questions to those groups doesn't make as much sense? Then it's what do you think we should be doing? You know, what reform do you think is correct is the question to be asking.
I think it's interesting that you bring up a proposal of a survey to the community. And I think that has valid discussion. I saw Commissioner Sorensen and then Commissioner Farr.
I'd like to make sure Commissioner Farr goes ahead because I've already spoken one time.
Very good. Commissioner Farr.
Thank you, Chair Buck. You know, I'm kind of a bystander watching the process. We all want fairness. We all want a non-political body to be making the decision. I can only speak anecdotally from how redistricting has affected me. After 2000, the 2000 census, there was a redistricting in the state of Oregon that actually ended up being done by a single elected official who made the final decisions for that. And it redistricted Oregon in ways that had the community of Shed and the University of Oregon in the same voting district. Absurd, absolutely absurd that kind of a, I hate the word gerrymandering because I believe it's overused, but that kind of adjustment can be made by a single official, and that would affect people for many, many years to come. After the 2010 election, census, a state elected official came to me and said, we've just made adjustments to the state districting that will make it so that a Republican can never be elected from House District 14 again. I'm a non-affiliated voter, but I was elected as a Republican from House District 14, as was my wife, who is also a no longer Republican. So, you know, that kind of a statement by an elected official tells me that there are people out there who really are intent on making certain that certain political parties or political factions have the edge in redistricting. I absolutely hate that. Redistricting, when I was on the city council, we had a major redistricting that took place where we had to completely realign the wards, and it was done very publicly. And ultimately, we made some very good decisions there that stand to this day, basically. So really, whatever we do, as long as we make it so that one person doesn't decide, as happened after the 2000 election, and that people who say we no longer can have a fill in the blank elected from this particular district, make sure that that kind of thing isn't possible. You know, that is absolutely abhorrent, and it's what everybody does not want to see, unless you're that one elected official who decided the 2000, or unless you're the one elected official who said to me what that one elected official said. So really, let's have a good process. I like a survey, but really what we need to come up with is something that that everybody agrees is not going to be political. You know, we determine what are the boundaries based upon not who is what the voter mix is, but on more direct reasons like geographical boundaries, like rivers, mountain ridges, etc., which has been done in the city of Eugene when we did it. For instance, the river was a demarcation zone. So anyway, however we move forward with this, let's do it so that the Secretary of State doesn't make the decision, and so the Oregon State Legislature doesn't make the decision, or that the Board of County Commissioners doesn't make the decision.
Commissioner Swanson.
Thank you very much. I've done a lot of reading on this topic, and one thing I would commend to anyone interested in it is to look at the materials that the Brennan Center for Justice has put together. They've analyzed, among other systems, the California model, which I think the League of Women Voters proposal is trying to copy. I am very interested in learning more about the League's proposal, and in particular what the experience has been in California, because they've had theirs in place now for over 10 years. So this is not new in terms of having somebody other than the Secretary of State or other than the Board of Commissioners or other than the legislature itself to do a redistricting. I think if we are going to have presentations on this, learning about the effect of the California model and whether it's resulted in what people are looking for, i.e., important but ill-defined goals like fairness. I like what Commissioner Burney said here to try to get us to a point of decision here, and that is, well, maybe what we ought to do is specifically invite a wide group of people in terms of a letter, perhaps signed by the board chair or the county administrator, that says, okay, we tried to make a list of groups, and Commissioner Bozovich mentioned minority groups. I would probably add to that Chamber of Commerce, labor unions, chambers of commerce throughout the county. We could also, of course, formally write all the political parties and just ask them to submit their written comments on all of this. And if that's enough for us to, formulate a work session by then selecting the comments that came in and the ones that are the most serious, have a follow-up discussion. And also would meet another goal of mine, which is to get this campaign finance thing scheduled sooner than this one. It also, I think, might meet Commissioner Bozovich's concerns that, what are we trying to do here? Who has really committed to this? I haven't committed to it at all. I think that there's a lot more that I'd like to hear about it before I commit to it. So that way we get an idea of whether there will or will not be a dispute on the board about whether having this situation the way we want it. The point about the Commissioner Farr mentioned about how unfair a single person's decision, such as a redistricting of the Oregon legislature that occurred several times in my lifetime, where the Secretary of State did it, and it's literally one person decides this, and it decides it for 10 years. To me, one of the problems there is the accountability. You have one person who may be finishing their term of office, even the year that they do the redistricting, and then they're gone. Well, that same criticism is present in the system where some independent people, so-called, if you can find independent people in a democracy as varied as ours, but these so-called independent people, they make the decision and poof, they're gone. There's no accountability by them at all. They're gone. They did it, and they don't have to tell anybody why they did it. They don't have to tell anybody. They don't have to stand for an election. They don't have to answer any questions. And they're about as accountable as a federal judge, except that even federal judges have the possibility that someone can appeal their decision. And so I would just say that's a piece of the idea that we hand over something to a group of people, and then they have no accountability once we've delegated that. So I just want to hear a lot more about that. I like the approach of having the county administrator, county council, board chair, someone invite all these people to give their perspective on this proposal that the league has made. And then the board as a group or the agenda team can decide, okay, we've heard some intelligent comments from these folks, from these different perspectives, and we want to then move to a discussion and then invite the people that have submitted the comments that are worthy enough to warrant them to make a bigger oral presentation at a work session. Thanks.
Okay, well, it sounds like we have decent consensus around having people submit written comment on the subject. I would also like to see a public comment session for people that aren't specifically written to write in about it. And then we have the idea of a potential survey as well to the community, all of which I support. I'm very much an advocate of getting public input on this, since it is a significant issue for our community. What we could do is, you know, as we're talking and county council is listening, we could delegate to county council after listening to us today to come up with a process to return to us to present, if that makes sense to everybody. Any thoughts? Commissioner Bozovich.
I think that makes some sense. I guess maybe, you know, based on some of the comments, maybe one of the questions on, you know, the leading questions to asking for written comment is, you know, do you desire for somebody other than the elected officials to have final say over the districts? And that'll kind of get to some of the concern of Commissioner Sorensen. And as far as, you know, over and done with, there's always the ability to challenge a redistricting, even if it's done by an independent commission in court, as violating some of the tenets of one person, one vote, and other civil rights, whether it's through the state courts or the federal courts. And in fact, many times it's a judge that overturns redistricting, as they did in North Carolina and other places where they felt they were done unfairly. And that opportunity was always there and available to that. What, you know, yeah, it's a pretty high bar though, to meet a legal challenge and have it reversed by a court and ordered to be redone for good reason. So there is an appeal process, and it's, you know, no redistricting decision is considered absolutely final. There's always the ability to make legal challenge. But I would like and suggest that if we are going to ask for written comment, that you know, one of the leading questions should be, you know, who should have final say over the boundaries, you know, and answer that question. And I will remind the board, if you go back in some of our board materials on previous meetings we've had about this, which we've been talking about for over a year, we did have California's systems brought back to us as a part of a report, along with some other jurisdictions and how they do redistricting, and talked about, you know, the success of the California systems. So so far, I haven't heard since they've made those changes anything coming back about you know, the independent commissions being unaccountable and bad districts coming out of it. I've actually heard a lot of positive coming out of California, and we actually had some of that written into some of our background material previously.
Commissioner Burney.
Thank you, Chair. I just want to say that I'm really impressed with all the commissioner comments. And I think it's very clear no one is trying to, as much as Commissioner Farr hates this word, it's very, because it's a bad thing. No one wants to gerrymander here. That's the whole point. No one wants it to be unfair. I can tell you, there are some people that are highly partisan out there on both sides that want to have more control of the process. And I think we agree we are the stewards of fairness here. So I'm not saying much new. I'm willing, Chair, if you would like, if Mr. Dingle would like to work with him on something he brings back to the board. But, you know, one, survey, specific questions. I think Commissioner Bozovich, I'm sorry, should I call you Chair Bozovich? No, I'm just kidding. Commissioner Bozovich, you know, who, how, what, right? Who should make this decision? How would those people be selected? What would that look like? And why? What's your rationale? But some kind of very simple thing where people could get right to the heart of the matter. 2, a dedicated public input session where we're looking at that and giving whoever else wants to comment that opportunity. 3, a work session that's been informed by those 2 things, where people are selected. I'm sure many of them would be the kinds of groups that Commissioner Sorensen identified in his last remarks. And finally, a decision on what process will be employed. But I think I don't think it's more difficult than that. Thank you.
Okay, sounds like we're having some consensus on, after all the ideas presented here, to have County Council come back to us with our input and delegate a process for us to proceed on it, unless somebody objects.
Chair
Okay,
Buck, Commissioner,
yeah,
I guess with the understanding that you're delegating a significant amount of responsibility to me in terms of one of the things I was trying to see clarity on is I've heard, I don't think there is consensus, or at least I haven't, on who the groups are. Commissioner Sorensen thought that it was 3 or 4. There are some other groups that Commissioner Bernie mentioned that I don't know who those are. So if the board's, the one thing I think there is consensus on is on the September 15th meeting, evening meeting comment, letting just the general public comment on the process. I don't know, I mean, I've heard some ideas about the survey. I don't know who we would send the survey to. Is it the board's intention we should try and reach every resident in Lane County? Or, and those are the kinds of things where those are pretty big decisions that the board, I think, has to make. I'm just trying to seek a little direction here. It's not very clear to me who the survey should go to.
Commissioner Sorensen and then Commissioner Bozovich.
I think the idea of a survey is good, but I will say, in the interest of not kind of having this whole project bogged down over what the survey is going to say, I think we should simply take the League of Women Voters proposal and send it to as many of the groups and organizations that the commissioners have discussed. I can make a list of those right now off of my head by saying all of the chambers of commerces, all of the labor unions, all of the political parties, all of the organizations that we might call minority group advocacy organizations that Mo Young may be able to tell us a broader list, and any other organization that the commissioners have mentioned in the course of this discussion, and send them the League of Women Voters proposal and ask them to submit any written comments on it if they have any. And then we will take a look at those written comments as a board later. And that way your task is more ministerial rather than some kind of big judgment call about how to ask these questions. And that's just my perspective. I certainly respect the idea of a survey, but I just personally want to get more information from people that are either following or affected by a redistricting decision.
Commissioner Bozovich.
Thank you. When I was thinking survey or something, I was thinking possibly something that was online, and then, our ability to use our social media and other outreach to get people to participate, would be a way, and that way it wouldn't be extremely costly. And if it was a few simple questions, maybe based off of, I agree with Commissioner Sorensen, we can use the league's proposal as a starting point. Maybe some questions that basically say, that reflect the league's proposal. Like, do you agree to have, an independent commission have final say over the boundaries? Do you agree that that there should be some group that appoints that, interviews and appoints that commission? Who do you trust to do those appointments? Maybe, we be fairly easy to design the survey based off of that proposal. and the questions off that proposal. I agree. I think Mo Young could identify the groups, but off the top of my head, I was thinking the local chapter, the NAACP, and some of the other groups locally that might be of interest. We can talk. That's something I think would just be a quick check-in, and maybe send the list independently to each commissioner to go. You missed this group or something like that, and just have them add that group to the list as far as sending the request for comments. I don't know if we'll get them all back. Every single labor union, I'm kind of wondering, that seems to be a very expansive list, from IBEW's local chapter to the local 626 to the carpenters to the teachers unions. Is it each chapter for each district, or is it I would think maybe the Lane Labor Council might be a place to go to get a response from labor. So that's just a thought to try and consolidate a little bit. But I know that Vice Chair Bernie probably might have a better suggestion there, as he's pretty close to some of those labor groups.
Commissioner Bernie.
I don't know whether to take that as a compliment or try to isolate me into it, but I'm just being silly.
Compliment.
I think, I thank you, because I do take it that way. Intent here is good. I think there's a couple of things. One, however you get that list, Mr. Dingle, give each commission, this is my suggestion, give each commissioner an opportunity to add to or input it, and give us a time frame where if we don't give you that information by X date, you move forward. The other thing is, yes, minimize effort. Find groups that represent broad categories. So the Lane County chapter of the AFL-CIO would, in fact, then be responsible, I would think, to make sure that labor organizations in this area have that opportunity input and empower them to do that. That's what they should be doing. We can do the same thing with various groups that represent largely unrepresented people. We can do the same thing with environmental groups. We can do the same thing with political parties. So I think it's gaining shape. I would just request, I offered to help, but I certainly don't have to with Mr. Dingle. But each step of the way, if you're looking for more specificity, I would do it via email with dates certain that you have to have our input and move forward. Again, I think and I really agree with Chair Buck, we can integrate the September listening session to be part of a process which leads to a work session and decision. Thank you.
May I add that our next meeting after today's and this evening's is August 18th, and perhaps we could all ensure that we have sent lists of organizations that we want to be included to Mr. Dingle by that time. If that makes sense, just to give us some kind of deadline to move forward. What do people think about that? Commissioner Sorensen.
Thank you so much. I was looking at another way of streamlining this, and that is, and I think you were going there, Chair Buck, if we were to provide Steve Dingle with the email addresses of organizations or individuals that we would like to have him send the proposal, the league proposal to, if we would give a reasonable deadline, you would give us, Chair Buck, or the board could agree on a reasonable deadline. I think you're trying to do. We could all five of us give a list of email addresses to Mr. Dingle by X date. He could then send the league proposal out. He could then ask the people that if they want to submit written comments, And that way, we would, I think Mr. Jingle is concerned that somebody later down the road is going to say, well, why didn't you invite so-and-so? Why didn't you invite so? And I think those are good points. For example, I would say that, you know, one of my interests in supporting workers on this board and in my, I guess, getting close to 40 years of elective office, that would be including labor unions that do not belong to the AFL-CIO, specifically one of the largest labor unions in America, which is the Service Employees International Union. They quit the AFL-CIO several years ago. So I would like to, you know, I would make my own list to submit, and I'd like to make sure that, and I like the idea of inviting the environmental groups and the different companies and different people that we often hear from in our work. So that way, each commissioner would be able to make that list. I might suggest we put some kind of limit on that, like maybe, you know, 10 per commissioner, a total of 50, something like that, so that we have to, it's not just a list of every one of our supporters or every one of the people we like, it's people that we've thoughtfully suggested. So that would be my suggestion. I'll just throw it out. In 2 weeks, we submit a list of up to 10 email addresses to Steve Dingle, and then he sends it out within a reasonable period thereafter, and we ask for comments within a 30-day period or something like that. That's my suggestion.
Chair Buck, if I can, Commissioner Sorensen, that's exactly what I'm looking for. I just resent the board the list of invitees that I have so far. So it would be, again, I'm just concerned that I'm not, environmental groups, that's a great example. I have no idea who that would be. So if you can send me those names, I can do that. And I do like the idea of, you can put down as many as you want or whatever the board decides, but if you could send me those in the next 10 days, and I'll follow this up with an email reminding folks, if you could do that in 10 days, then I can, by the time we have the August 18th meeting, I will send out ahead of that meeting with the materials for it, what I've tried to distill down and glean from the comments that the board has made in terms of the process, who's invited. I'm hearing consensus that the initial thing is that you would want written materials that would be sent to the board, that ahead of any work session where there would be theoretical comment or back and forth between the board. I think I'm hearing consensus about that. If that's not correct, please let me know.
Okay, so in 10 days, let's say that's August 7th. And the list that Mr. Dingle mentioned is attached to the materials for today's session as well. So if we can all agree to look at that list and add names no later than August 7th for Mr. Dingle, he'll have time to compile them all. And then he can come back to the board with that, and we can move from there. Is that sound right, Mr. Dingle? Did I miss something?
No, Chair Buck, that was actually really good. The one thing I would ask, it would be very helpful to me that if, in addition to the Commissioner Sorensen mentioned this, that in addition to the name of the group, if you would supply me with the email contact information as well, that will help me greatly.
That makes sense. Okay, and I don't necessarily support a limit per person. I think if you have people that are interested, they should be invited. Commissioner Sorensen.
Thank you. Chair Buck, you just said you don't support a limit. Are you okay then with commissioners contacting their supporters and asking them to send in email to the board saying they like or dislike the proposal? In other words, my idea of putting a limit, and I don't really care what that limit is, whether it's 10 or 20 or 50, but my idea is that we carefully select these people. We don't just ask the general public. Do you favor a system where there's no accountability? I just don't think that's going to be adding much to my understanding of this. And I'm looking for some thoughtful comments from people that have taken this seriously. I'm not looking for a public opinion poll, or even worse, a skewed push poll to on the topic. So you're saying basically you're okay with a large number of people, and I'm just saying I would favor a limit on the number of people being specifically invited by Lane County Legal Counsel to give their views on this. They can all find out about it potentially through the public nature of our work. I'm talking about the effort to obtain informed public comments on these proposals. Thank you.
Commissioner Burney.
I don't think any one commissioner has the right to censor who is informed and who is not. I like the chair's request to simply, forgive me, Chair, I'm not trying to put words in your mouth. So correct me if I'm wrong, but we want an inclusive public process. I think, honestly, I think that comment and the comment about SEIU is not in the AFL-CIO, fine. The point being, there are mechanisms to reach out to all unions. I feel we have clarity on this, and I'm ready to move forward.
Okay. And it's just to add to that, it's my understanding that we are giving a list of organizations, groups, to Mr. Dingle by the 7th. But yes, inclusivity in this whole process is really important. So do we have enough head nods on this so far to move forward for Mr. Dingle? Okay, looks like we do. All right, thank you very much. We'll keep working on this as it proceeds. So with that, we'll move on to number 9 on our agenda, which is county administration announcements. Hopefully we'll have Mr. Mokryski there.
Yes, I'm here. Thanks. I think we covered everything, Chair. I wanted to just make a note that apologize for the mix up this morning about recognizing Cindy Morgan. I had planned to do that under county administrator announcements, but I shared with the chair, one of the challenges in this remote environment is things that were simple communications before are much more complex now. And so where I would have previously been able to really easily give the chair sort of a quick heads up before the meeting started, that just didn't occur. And so I apologize to the chair and to the board and everyone for the miscommunication there. I think we updated you on everything. I'm happy if there are other questions. Karen talked about, I was going to update you on the business assistance grant word that we got from the state this week, which is really exciting, but we talked about that. I'm happy to answer any of those questions. There was one other grant that we received, as I'm trying to keep the board up to date on grants. We received a $314,184 grant that we applied for. Were awarded in late June from the Oregon Criminal Justice Commission. This is a pass-through competitive grant from the U.S. Department of Justice, Bureau of Justice Assistance. And Lane County was awarded or received the award for $314,000 that will fund the Lane County Sheriff's Office and a variety of community partners for various services. Then we also received a little over $1.5 million in pass-through funding for energy assistance and weatherization through the CARES Act. So I think those are more, in addition to the business assistance grant, again, for the public's benefit. These are mostly pass-through dollars that we're getting from the state and federal government that we're then providing to businesses or residents that qualify for those resources to help mitigate the impacts of COVID-19. So that's everything I have on that. I know we have another item here. We're getting close to the noon hour. If you don't have any questions, that's all the time. But I'm happy to take questions if you have them.
Commissioner Farr and then Commissioner Bozovich.
This should be a quick response, Mr. Mokrowski. Earlier in the meeting today, Commissioner Sorensen was talking about the lack of a plan in Lane County and asked for the staff to work on a plan regarding COVID-19 response. I listened to yours and Ms. Gaffney's response to that and the presentation. It seemed to me that we do have a plan. Is that correct? I would hate for the public to think that we don't. Is that just a point?
Yes, we do. And I just want to, I want to make that really clear. I'm happy. I think if the, you know, certainly the board needs to, you need to all understand these 5 areas that we're focused on. The public needs to understand those. And so I definitely welcome your thoughts. If there are things that we can be doing, you know, there are all kinds of meetings, virtual meetings and email updates and information we're sharing in various forums on the website. I'm doing these daily communications. We're doing a once-a-week call with all of our city partners in Lane County. Karen told you about the twice-a-week meetings public health is having with all the schools. Commissioner Burney has to be a part of. You know, again, some of the challenge is the way in which we're not meeting in person. And so there's a lot of things happening, but everyone understanding all of the things that are happening and all the moving parts, it's inevitable that there are going to be some things, you know, either lost in translation or not fully communicated to everyone that we need to. So please tell me if it's helpful. Commissioner Sorensen mentioned, you know, putting it on our website would be helpful. We'll do that. If it's helpful to have a card that says, here are 5 strategies around management of COVID-19 in Lane County, and laminate that so you all can carry around, understanding it's going to adjust and flex, we can do that. So please tell me what we can do to better communicate and make the board and the public aware of all the work that's happening, and particularly our strategies. But very important to know that we have part of the reason that Lane County has fared so well to date is the fact that we've been on top of this since the day after the first case of COVID-19 was identified in the United States. That was January 21st. You know when Lane County Public Health started talking to OHA? January 22nd. And we opened up our EOC mid-February, a month before we ever had a positive case. So this, you know, the work that's happening, it's not to say everything's perfect. We continue to adjust and evolve and do what we need to do. We know the governor is going to have a press conference today at 1:30 to talk about schools. Inevitably, there's going to be some new information that we need to digest and adjust things to. So we will, you know, continue to be nimble, flexible, responsive to those changes. But please know that if nothing else, we are being as aggressive as possible at putting all hands on deck for this response. So you always say it's going to be a short response, Commissioner. I apologize. That was a long answer to your very simple question, but I want to just provide some context there.
Thank you, Ms. Mokrowski. You earlier said that we have a very detailed and robust plan. I wrote that down. I also wrote down that somebody suggested that we had been in Lane County, maybe been lucky. I would reject the fact that we've been lucky. We've been well planned and very deliberative. Thank you.
Commissioner Bozovich.
Thank you. Mr. Mokrowski, I have a quick question about the CARES Act funding that's supposed to come to communities under 500,000 in population. We know that Washington County, Multnomah County, and Portland all got direct funding with no filter or portion taken out by the state. Have we, and other communities under 500,000, have we gotten our share of that federal funding? And what's the discussions with the state? It seems like they're trying to hold back some of it, and they're also making that funding available with strings, i.e. we're having to apply for it. Is that the case?
It is, as the board knows, we applied for and were awarded approximately $5.5 million in the first round, and the state has continued to sort of adjust what they've made available. To answer your question directly, we did not get a direct allocation and funding directly that came to Lane County as those larger metro areas did. We've been given, there have been resources set aside by the states through the CARES Act funding that we then have to go and apply for. Again, the majority of the funding that we have yet applied for from the state, it's my understanding they've set aside approximately $10.7 million, give or take, for Lane County. But we've had to go apply. So we applied and were awarded I think it was actually 5.3 million. We applied for 5.5. We were awarded 5.3. These were reimbursement costs, right? So these were costs that, you know, are things already spent. That included the $1.8 million for the Hunter River Avenue acquisition. Okay. So the other approximately $5 million that has been set aside for Lane County still requires us to track our costs, account them, and then submit for reimbursement, which we are actively doing. We have a finance team as part of our emergency operations center, our incident command structure that is set up. This is part of our robust planning and implementation work on COVID emergency response. Finance team that is tracking all of our expenses and making sure that we go after and submit for reimbursement for everything we're eligible for. So I want the board to have a level of, I mean, we're meeting on this, and Chair Buck has been a part of our meetings. We're meeting once a week on a CRF funding meeting on Wednesdays for 30 minutes where we track this and talk about all of those expenses. Does that answer your question?
To a degree, I'll ask a follow-up that I would like you maybe to answer at a next meeting. Obviously, do Portland, Multnomah, and Washington counties have to account and show the reimbursing, or did they get a direct allocation? And what is the amount of money they're getting per capita versus what the rest of the state's being given from those CARES Act fundings to local governments? Because I have a feeling there's Portland and then there's the rest of the state, and we're being treated entirely differently from the rest, from Portland, that they're getting more dollars per capita, they're getting it unrestricted, unaccountable, and we're getting less money per capita, and we're having to do all this extra accounting for it. And I really want to understand that, and you don't have to answer that today, but I'd like to answer on August 18th.
Okay, and I'll make a quick, Mr. Kyler, let me just finish the thought, Mr. Dingle. Mr. Kyler corrected me on the first 5.3 million that I noted that we applied for. We applied for 5.5, we're awarded 5.3, is separate from the $10.7 million. So that is a separate account. We definitely can respond to, Mr. Dingle might have some information, but we can do an analysis of what has been allocated, the direct allocation to those other counties compared to Lane County. I'm not aware, and maybe Mr. Dingle is, of whether or not the direct allocation counties like Multnomah have to account for those costs or not. We certainly do.
Chair Buck, Commissioner Bozich, I can give you a very brief answer. We can provide a more detailed one on the 18th. The short answer is no, because the original act gave the direct allocation to those jurisdictions over 400,000 or whatever it was. So they received that money directly. I will tell you that we've had multiple conversations with the state and get different answers depending on who we talk to. But the state, at least to this point, has taken the position that they are responsible for the distribution to the subrecipients, of which we would be one. And so that's their explanation for providing the strict guidelines. And they, at least the one person I talked to at DOJ believes that they are legally bound by this because the E-Board has adopted a reimbursement model. And so they believe that since the E-Board is directed in a reimbursement model, the state does not have the authority to come up with some sort of general distribution to the counties. And as I think I've made clear, it seems a little ridiculous because what they're saying is we have already had to agree. I think it's Mr. Mokrahysky and I both have to sign a certification that any money that we receive through this federal funding will be spent in accordance with the CARES Act. It's kind of a long answer, but that's basically where we are right now.
Yeah, still somewhat confirms we're being treated differently out here in the hinterlands than Portland and the metro area are.
Let me add that EOC probably has all that information compiled that we could gather, but I would agree that is the case. Commissioner Sorensen?
Sorry about the computer thing here again. I just wanted to get the clarification maybe from Mr. Mokrahysky about the exchange I had with Ms. Gaffney earlier, and she, as I recall, said that she would be putting some more data and goals and plans up on the website. Could you recount that so I can get as much precision as we can get here? Because I agree we have a plan, and I agree it's working well. I was quoting other people on the topic of whether we were lucky or not. Obviously, we have been lucky, and it's not just a matter of luck. It's also because of the great work that's been done. But I just wanted to circle back to what is going to be put up on the website that currently is not on the website.
Well, I mean, you know, we can put up whatever the board would like us to put up. So part of what I have been asking is tell us what you'd like, and we can accommodate that. I went through the 5 general areas of our focus that can you hear me? I just got a notification. Can you hear me okay? Okay.
Yes.
I went through the 5 general areas plan for emergency response, including containing the spread, provider needs, economic impacts, public information, and preparing for the fall. Within each of those priority areas, and then a bunch of strategies and goals underneath that, we can put, you know, we'll put a little bit more detail to that so people understand isolation and other pieces. So it can include that. I think what I would argue we should be careful just not to put too much on is you know, some of our goals and strategies are going to change because this is changing on a daily basis, a weekly basis at the very least, but a daily basis. And so I don't want some of those more tactical things at the ground level to become out of date too soon. And I will tell you that we are airing, while I think our public information work has been incredible because we've been having daily news conferences and press releases and updates daily on the website for 5 months. I will, and we will always err on the side of focusing on the response to the community need, you know, as the first priority. So that's what I would tell you is we can start with putting that general information up with a little bit of detail. And then if there's more that the board would like, we certainly can make that available.
Thank you.
And I'll make you I promise you this, I will make each of you a laminated card because I know how much you love those.
Thank you.
Commissioner Burney.
First, I don't need a laminated card, but thanks for the offer. Second, I don't know if you recall, but when Commissioner Farsh discussed being disappointed, he was disappointed because the information on COVID on the website was a day late. Sir, you remind me of my father. I could never get his approval. And Steve, you started this piece of your discussion by explaining everything you were doing, and you apologized because of technology and distance, the lack of sometimes coordinating, and if we had any ideas for what you could do to improve. Have you heard the word omniscient? All you need to do is just read our brains, see what we don't have, and share it with us. I don't see what's so difficult about that. I apologize. I think that we will never have a perfect plan. We are the tail that feels like it's wagging the dog as it relates to a coherent national strategy to contend with, again, what I think is a great reckoning of issues hitting at the same time. And I think that the deliberation and the plan, and I'm saying this because it was questioned whether we had a plan, the deliberation and the planning the constantly readjusting, the never being good enough, and the good luck has been something that has been a blessing for all of us in Lane County. I hope it continues, because really, to a degree, this is somewhat out of our control, and we're doing a wonderful job. Thank you.
Very good. Okay. Well, it is, we're entering the noon hour. We have a choice to either roll over the discussion on open board assignments or go through it right now to finish up the day. Does anybody have any preference? Commissioner Farr?
If by rollover you mean to a subsequent meeting, not this afternoon, I would agree with that.
Right, to a subsequent meeting.
Yeah.
It's not necessarily urgent, but we thought we might have had time today to do that. Commissioner Sorensen? We can't hear you. You might be on mute.
Thank you. I'm sorry. I just put my thumb up because I agree with what Commissioner Farr said. Thank you.
Anybody else? We're good to roll over to a subsequent meeting? Okay, let's do that. So we will roll item 10A. Any commissioner announcements? Okay, I don't see any. Any future board assignment requests? All right, I don't see anything there either. Review of assignments.
So I'm gonna take the request for information on the website and around our COVID-19 emergency response plan, not as an assignment, because I don't think we need to put it on the assignments list and track it as a long-term thing, but I'm just gonna let you know that that is something that we're following up on. Commissioner Bozovich asked for some additional information regarding the CARES Act funding. And I'm also thinking that's probably not doesn't need to be an assignment, but in 2 weeks, we'll just report back on that. So I'm making notes of that we'll provide that information to you. And then that was all I had, but I was trying to track and I know Mr. Dingle has the redistricting item. I don't know if that's already an assignment. So I'm not necessarily hearing that there's anything new that needs to be added to that one. So I guess my bottom line is I'm not hearing any new assignments, but there are some tasks that we're going to follow up on.
Okay.
Did I get that right?
That's what I heard as well.
Okay.
All right. We don't have an executive session today. Any final emergency business? Any other business?
I just want to note, Chair, that tonight your joint meeting with the Eugene City Council will be on a Zoom platform, so it's a little bit different. The City of Eugene staff is managing that platform. So Ms. Jones, I'll be on there, and our staff, Sarai Johnson and Steve Manila and others, and then the city staff will all be there. Ms. Jones will be available to coordinate, but doesn't have oversight of that platform. So it'll look and feel a little bit differently than our board meetings here do, but really looking forward to our time tonight with you.
Very good. And it is at 5:30, although we've been asked to get on a little bit early just to make sure we're all ready to go at 5:30. Okay, well, if there's no other business, we are adjourned. See you tonight.